Okay, I call this meeting to order at 5:36. Do we have a quorum?
Yes, we do.
So, Nathan, do you want to lead the pledge, and Ben, will you pray for us?
Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Very good. Lord Jesus, we thank you so much for our ability to come to this place and have this meeting. We thank you for our community. We thank you for this hospital. And we thank you for everyone that takes the time to lead this hospital and also to meet and discuss the business. We ask for wisdom, we ask for strength, and we ask for guidance. In the name I pray, my Lord Jesus Christ. Amen.
Amen.
Okay. Okay, do we have any visitor comments?
You might have to speak up.
Oh, yes. Do we have any visitor comments? Are we all good? Wait, do we have any additions or changes to the agenda?
Madam Chair, I'd like to request that we add a discussion of meeting dates, probably after the consent agenda.
Okay. Do we have a second for that? Or do we need a second?
I will.
I don't think we do. Okay, so, and then the other thing, Allison, do we need, if we are talking about Article 1 and Article 2 on the bylaws, do we need to have more than what we've got on our agenda? We have at the bottom board governance and then bylaws and then setting the time.
We can talk about it, and as I have provided the board advice, it's important to notify the public if you're planning to make changes to the bylaws. So what I would suggest is, if you want to discuss them, just that we not take any final action on them tonight.
Okay, okay, thank you.
Madam Chair,
Uh-huh.
may I ask what's on our consent agenda?
Do you want to?
All I was going to talk about was the future of the consent agenda that sits there, but, so I'll talk to you guys a little bit about what I'd like to do.
So, right now, the consent agenda would be the minutes and the agenda itself, the February
Yeah, sorry.
20 minutes.
So that should be added to the consent agenda list.
We've got it.
Okay. It's just basically the minutes and the agenda is the consent agenda. Is that right?
Yeah, so now you just need to get approval for the minutes and for the
So we
agenda.
can't change, but we can't pass that because both things have to be changed. So we'll just pull them both off the consent agenda and make them agenda items. Is that fair?
Mhm.
No.
Yeah.
Okay.
Okay.
Okay. So right now, the only change we have to the agenda is meeting dates. Is there anything else we need to? And that we'll just have the minute, rather than a consent agenda, we'll have the minutes. Basically. Anything else? Okay, so I need a vote, or I need a motion and a second.
Madam Chair, I move that we accept this agenda
With the changes.
with the change.
Second.
Okay. So Ted moved and Ben seconded, and all those in favor say aye.
Aye.
All those opposed, same? Okay. Okay, so now the minutes. Do we have, what do we have?
Do you need those pulled up or do you want them pulled up?
It's fine. We can
I just have a couple
You must have some
changes.
changes.
You must.
I can see you have some changes, so let us know.
On page 2, number 2, it reads, if we start in the middle, the banner income is increased. Benjamin Roberts has joined the Finance Committee due to Ted's absence. I'd just like to change that to clarify. And that's, I had the suggested change, Ben Roberts joined the February meeting of the Finance Committee due to Ted's absence, because I didn't want Ted to read the meeting minutes and think that he had been replaced. He missed one meeting, and that wasn't.
I still think that's fine. I appreciate it.
And then the last line reads, Karen states that the committee is encouraged and excited about the hospital's finances. I'd like to change that to Karen states the committee is encouraged and excited about the progress the finance team has made. Because I'm not excited about the finances, I'm excited about the progress we're making in the finances. If that's fair with the committee. On the bottom of page 2, number 4, working on a sliding scale for copay due to Medicare Advantage plans. I don't remember that discussion, but I'm not sure that that should.
That was, we were talking about home health, not home health, we were talking about the clinic needing to have a sliding scale fee that they didn't have in place that's required for us to have.
Right, but the way it reads is.
It's not reading correctly.
Well, it says a sliding scale for copays due to Medicare Advantage plans, which wouldn't be,
No.
we would be out of compliance with Medicare guidelines if we
Right,
did a
right.
sliding scale for copays.
It's not, just strike Medicare out of there.
Okay. So,
and Medicare.
so why don't we just strike out working on a slide, why don't we just leave the agenda item to, leave it to say working on a sliding scale, period.
Yeah, that sounds good.
Okay,
Where is that at again?
number 4 on the bottom of page 2, under med staff and quality.
Okay.
Yeah, she's doing them right now.
And then under the manor report, number 4 also says Medicare payment has been looked into and improvements have been made. I don't think it's Medicare because we don't get paid by Medicare.
It's Medicaid.
Does somebody else want to be secretary?
No, Mary, you're doing a great job. And would you rather that I send things like?
No, I'm just saying if somebody else wants to take over.
You do a great job. Very, very grateful for you.
I am, I'm just taking a lot of her words,
Yeah,
but I take minutes too.
Yeah, it needs to take minutes.
we're working on that piece.
Because it's really,
It's minimal. You did a great job and I feel bad about saying anything in the meeting, but that's the.
We want it to be
have do.
reflective, yeah.
I just don't want that to be out in forever land.
She's got the changes.
Yeah, she got the changes, yeah, you're good.
is there anything else?
So do you want to do them with the amendment, or you want to wait till next time?
No, let's make the changes.
Changes, yeah.
So,
That's okay with the rest of the committee.
so we need a motion to do that.
I make a motion that we make the changes to the minutes in the February meeting.
So that that we accept the minutes.
That we accept the minutes
With
with
the
the
amendment.
changes from the February meeting.
I'll second.
All those in favor say aye. All those opposed, same.
Madam Chair, I noticed I didn't vote. I wasn't there,
Oh, that's right, yes.
so it was proper for me to vote on the minutes of that,
You should
for a
have.
meeting that I wasn't there.
We'll put you down as abstaining.
That's fine, that's fine. You don't have to reflect my motion at all, that passed.
Yep, very good. Okay, so, we got all that. So then, the meeting dates. So, mention that it's sort of that way in April, it's more that way in May, where the first day of the week is a Thursday. And so if we did our normal third Thursday would be the 15th, but the third Tuesday and the third Wednesday, so the third Tuesday for Finance Committee and the third Wednesday for Quality would be after our regular meeting. So I wonder if we want to move our regularly scheduled meeting to the 22nd.
Okay?
Previously, we have moved
I think I saw the meeting up.
we moved those meetings up before.
So it's like when you look at the calendar, it still makes it the second week.
Yeah, I think
I would
it's
prefer
okay.
that we move the board meeting
To the 22nd.
to the 22nd.
I mean, I guess, but it's what everybody thinks, it's
Yeah.
not just
The 22nd of what?
of
May.
May.
So instead of the May meeting being May 15th, that would be May 22nd.
I think I might be going.
That worked for me. I'm retired.
You are this year. Congratulations.
So I
I'll be going on a big retirement trip.
So if we have it on the 22nd, we can have a party for you.
So do you retire from feeding cows or?
No.
What's the rest of you think?
I know I'm not one of those weeks, so I didn't put it down on my calendar. I'm not gonna be able to answer that.
I'll be gone the week before too, so thank you.
Can you please,
Well, the week of the 15th would be much better for me to just do everything that I kind of built my schedule assuming we would
Okay. so
follow
we
the
didn't talk about
normal
it fast
pattern,
enough.
but I could try my best to make it work.
What are you saying, Kathy?
Well, the only thing I will say to you is it's giving us less amount of time to get our
Get
paperwork
everything ready.
together.
If
That's
it's
just-
right, if it's on
weeks, not
the, if,
3.
Yeah.
right, and that was what I wanted to bring up about April too, because that puts the meeting on the 17th and Finance Committee on the 15th. So it's quick when you close everything on the 10th. I know I could way over all that stuff, but we can do it.
It's whatever you guys want.
April's just not near as stark as May.
Correct.
May
May's
is really,
Yeah, May makes it really fast, and it actually puts the meeting in the second week of May rather than the third, so. Up to the committee.
okay, so
I'm gonna check to see when I'm going here, so.
so Nathan would prefer that second week, basically. Ben doesn't know. Ted, it doesn't matter to Ted.
Doesn't matter to you.
Okay.
I don't really get to say. I'm just telling you it's quick.
Yeah.
So it'd be better the third week.
Of May.
Yeah. It's better the third week for me too.
Not to mention that not that you guys would care, but I do have a wedding to go to. May 11th is the wedding, and so that means I'm not going to be here for a few of those days too. It's in Montana.
It appears that because of the closeness to the first of the month, it's going to make it difficult for staff to put things together, to make a presentation like they normally do. What day are we thinking in April for the regular meeting?
I personally would like to just keep it where it's at.
Okay. Madam Chair, I move that we take the May meeting and move it to May 22nd, 2025.
I'll second.
And also move the Finance Committee.
Well, the Finance Committee would be able to stay. if we move to the regular meeting, because then finance committee would be the 20th and quality would be the 21st.
Okay.
So those
As long as
two would
there's
be able to stay.
no changes in that, so that is the end of my motion.
Michael Stolken did things right. And what Nathan Todd did in that meeting, dressing him down, he said not to pick sides. No, he did pick sides. And he picked Becky Hadlock's side. And once again, Becky Hadlock was wrong. So thank you on behalf of the people of Weston County to Michael Stolken for stepping up and doing the job that the people elect him to do.
Well, and not only was she wrong, but once we finally got our records request, she was even more wrong because it was incomplete. And the state public records ombudsman admitted that and said that those documents should have been included. So I just find it interesting that everybody puts faith in someone who continues to make the same mistakes, which at this point aren't mistakes.
Okay.
So those
As long as
two would
there's
be able to stay.
no changes in that, so that is the end of my motion. Madam Chair.
Can we discuss, I'm not sure yet, but I think I'm pretty much, I'm going to be done on the 22nd.
Okay.
So we're going to be able to attend that meeting.
Okay, so will Nathan be going to?
I think I can make the board meeting. The finance committee meeting is iffy, but I could perhaps zoom in. So I think I can make the board.
Is there any way that you can zoom to the regular meeting?
I might be able to do that, yes. Yeah, that's a good point. I didn't think about that.
What about you, Corinne?
I'm fine and open on either dates in either month.
Okay.
Thank you.
Okay, so.
So the April meeting will be on the 17th.
It will stay the same.
That's the regular time.
So, so are we ready to vote then? Because we've had a motion and a second, and we've been discussing, so all those in favor of moving the meeting date to May 22nd, say aye.
Aye.
All those opposed, the same.
Did you say anything? Corinne, are you an aye or a nay? Aye.
Okay.
I'm an aye.
Okay.
That's fine.
I've been sitting here feeling like we were missing somebody, and then I'm like, we are missing somebody. Corinne's on Zoom. Okay, so that has passed. So now, Tish, I think we're ready for the finance stuff.
Okay. I want to let everybody know that we're continuing to go ahead and work towards the completion of our 2024 audit. We have started uploading things to the auditors.
Just real quick, do you have any papers?
I have all these papers. You didn't print them off the website?
I did look at them on the website. I didn't print them off of the website.
I have some. I can go make more if you wish. Oh wait, there's another one.
Thank you.
You're
I
welcome.
appreciate it.
Does anybody else need a line of mine?
I have.
Finance committee?
I have,
Carrie
we got
has
to
hers.
go finance.
She's very quick. Is there two here? There you go. Ted, do you need one?
Nope,
You have?
I've got one. Oh, here it is.
You can shred that.
Thank you.
Thank you.
Okay, thank you. Sorry for that interruption.
Oh, no, I'm sorry, I usually ask, I was distracted. So we have started uploading things for our 2024 audit to the auditors. We are just fine tuning a little more adjustments that need to be for the trial balance. So that's considering where we started. We're making good progress there. I have received everything from all the department managers that I need for their audit. And then we have reached out to Monument regarding the Charge Master Review report, the custom report. We have created several reports, that we're trying to back that data in so we can get the quantities, the utilization of our charges, what our charges are individually. We had to run separate reports. And Ready Health is willing to go ahead and at least start work on that. We have not gotten any update from Monument. We have reached out to their ITS department. As far as cash flow, and we're continuing to maintain on our cash flow. I would like to see a little more effort done through follow-up on the business office, which they have started implementing. We have started doing task lists and correcting their work buckets so we can make sure that we are collecting payments in the most timely manner available. So we are still working on our CMS price transparency delinquency. There is 4 lines that belong on the root report that we didn't have. It's the hospital name, the hospital ID number, who the contact person is, and the phone number. Our current website is unable to support that root file. So we have gone out and gotten another vendor, and they are working to get all that data ready. I have had a meeting with CMS. I called Renee Richards, who is our representative with the price transparency, and she just said as long as we keep in contract, they will let us continue so we can get our new website up and running with all of the requirements embedded in it. So at one point, we didn't have any contact with them, and we were concerned that they would elect to levy a fine. So we reached out to their department, and they were very gracious in allowing us an extension on that, provided we maintain our communications with them. So that was okay. That was a huge relief to everybody. Our accounts payable, we have now started emailing all of the invoices directly to the department managers for them to approve electronically. So those are done. At the present time, when I started this report on March 7th, our accounts payable was down to $298,000, and all of our accounts were in 0 to 30 days. So that's a huge improvement from when I got here. So congratulations to staff listening to me complain and actually listening. So the inventory. So we have started on our project management. Wendy is our project manager for the implementation of SAGE inventory. Everything has been sent to Wifley. We are having a go live meeting to iron out any missing items or time frames on Monday. And the new department manager, Jason, myself, and Wendy will all be attending that. When we spoke with our rep, Sam Lipton, he thought that we would be able to go live with our inventory, utilizing the inventory within 4 to 6 weeks. Which I thought, that was pretty good. So all of the historical data has been entered and balanced into SAGE. I gave the finance committee their first set of tentative financial reports. So I'm in the middle of still cleaning up, which is why they haven't gone to the general board yet. We are doing some misposting corrections, and things have gone into the wrong periods. We're supposed to put it in February, we put it in March. You know, just a little cleanup so that everything reflects period-wise correctly. So that was kind of exciting, the end of 4 months. I'm like, phew, at least the end is in sight, so that was good. We started having transmission errors again. When I first got here, I said we were getting transmission errors. Our postings, our revenue, our cash postings from Epic are not coming over cleanly into Sage. It's a GL mapping issue is what it is. So what's happening is they're hitting a bad general ledger number that's running in the background, and so it kicks all of those transmissions back. So we have 1 in January, we have 6 in February, we have 2 in March. So we are working on that. I had a meeting with them today. They did the update to the software, and we're hoping that we can start our retransmissions tomorrow or Monday at the very latest. What the problem is we can't see the monetary value attached to those transmissions. So we're hoping it's not too big of a financial review. The majority of them seem to be hitting the credit card bank account because it's out of balance by $1,700. So if that's all we're looking for in February, that's pretty good. Novitas, which is our Medicare intermediary for our clinics, has finished their desk review. We file a cost report with them, then they turn around and have their desk review department double check all the information that we've sent. We received $47,000 from them for our cost report. They're taking back $42,000, which we kind of knew that it was going to happen. And then, we'll just move forward with our 2024 corrected. So we should be able to recoup some of that. Noridian, who is our hospital MAC, has not completed their desk review yet. But we did set aside all the money we received from the cost report in the event that they want that back. Until we can get all the corrections and everything filed, we're going to be kind of going up and back and forth. So that's pretty industry standard. It's not really horrible. At our finance committee, Nathan noticed that we made a mathematical error on our utilization statistics. So I have paper ones. They're color coded. We made a formula error. We forgot to do the denominator on the manor occupancy percentage. So, and it's kind of a little purple. So it was, we had it at 70%, it should have been at 75%, so it's kind of that pinky purple one there. So then we went over our cash, which Nathan had brought forth some requests. I have sent to the finance committee a tentative cash flow paper for them to take a look at, and I'm assuming they will go ahead and give me feedback on the new cash flow. So we still have our old recent cash flow. Can you put the cash flow up on the side? I don't know if you can or not. Does everybody have a printed copy? Okay. So basically what we're looking at is, I have the wrong one.
I don't.
Is it in there?
Yeah, that's the one. Is this one?
Yeah.
It's this one here.
I've been doing new work, so I've got 3 years worth of these sitting in my folder, so let me go ahead and.
There you go. It's up on the one.
Yeah. So basically what we're looking at is we have not done any transfers out of our money market account. We are holding steady. We will see more as the Medicaid comes in for the nursing home. We will see a spike when that happens in that deposit. So it kind of tweaks your line a little bit. It goes up and down. And until that becomes stabilized as a process, we will continue to see some spikes on there. And that's normal. That's very normal for nursing homes to experience that, because you take the patient and then there's not always having adequate or current Medicaid enrollment. So the credit card is the one that we're off by the $1,700, but it's not material. So we did go ahead and put it in there on February. That is the one. So you will see an update when that gets, the missing deposits get posted, and then we complete the reconciliation. So the county treasurer payments. So I had to call the county because I am not familiar with how that particular program works. And what I was told is that that is our portion of folks that have made their tax payments. And that's why it's a little different. Because I asked her, I go, am I getting another check? You know, I'm used to seeing another 100,000 in front of that. So, and she said we would get that current, but when they date of issue, that's what we had. That was what our percentage was. So that was educational for me. I didn't know if everybody else probably already realizes that. So we're holding steady.
So I think the bulk of because they kind of timed to come in December.
Yeah.
I mean,
She didn't know about the free payment thing and all that, so
I
gave her a copy of my tax bill.
So
she can familiarize.
Yes, so I can kind of figure out what the tax bill is supposed to be, because I'm like panicked as to why I don't have enough money sitting there in my tax account.
Can I ask real quick, any idea why we have the non-payroll going back up again?
So the expenses.
Yeah, no.
I mean, we have some payroll expenses. So I went in and did a deep dive on those this afternoon, which is what I was looking for, because I was trying to see, do I want to break those out so they're more informative? Because what fluctuates is our medical insurance. It runs, there are some months when we had 4 bills that came in. There are some months when we had 4 bills that came in, and then we had that were well over $700,000, but they were all dated then. So, and then we had others that were less than $50,000 for the month. So I reached out to Blue Cross Blue Shield, and we have a rep there, and I said, okay, I need to know how you pay. So do you review the claims and then bill us? Do you review the claims, pay the claims, and then bill us? So what's the timing on that? Because we can see typically when the claims are submitted to Blue Cross Blue Shield.
So that's under salary and benefits?
Yep.
Okay, how about the non-payroll though, going up?
The expenses went up.
Yeah, it's just not any trend that we can point to?
No, that is not a trend. A one bad month is not a trend making.
I was hoping to see it stay under $1 million is what I was.
Me too.
That's why I'm asking the question.
Yes, me too.
Can you tell them what the variance is?
On
that amount, as far as what made that number a little higher?
Yeah,
I think that's what he's
about
asking.
150,000 more, somewhere in that range. I mean, not specific, you don't have to be specific, I'm just curious if you knew.
Nope, nothing.
This one's very different.
Yeah,
Yeah. The non-payroll items.
Yeah. That's such a broad category now.
It
to
is.
Just about anything. But.
And hang on just a second. I have all the details. I didn't think anybody would notice, so thank you for asking. Next time, no, don't be sorry.
Big numbers jump out.
Yeah, this was it. So what we're looking at is we had operating and maintenance expenses were $405,000, and they jumped up.
Thank you.
I didn't bring any more detail than that.
No, you're good. I appreciate it.
Okay. So when we have the financial reports, there'll be a little more detail involved with it. I'm looking forward to getting a little bit more of that. We're also going to be changing the little bit of the accounts receivable reports. We're going to be reporting on your accounts receivable days will be total. Historically, for whatever reason, what was reported was just the hospital days on our accounts receivable reports that we gave to the board. When in actuality, we have the professional component as well, which is part of our accounts receivable. So as an example, if you look at the colored reports, it shows that our AR days are 49.4. That is what our hospital AR days are. But we have clinic days as well. and that brings everything up to 52.3%. So that's our actual target to reduce. And what I'd like to start reporting is we will be reporting industry KPIs. Discharge, not final bill. What's our total? What are we waiting for? Are we waiting for coding? Are we waiting for documentation? Something that gives you some idea of where we actually are. A breakdown of our AR days by payer, Medicare, Medicaid, insurance, self-pay, and then other. So if you have any ideas or requirements or thoughts, please feel free to let me know, or let Carrie know, or let Nathan know, so we can carry that forward. I'm looking for the reports to be a little more informative and to mean something and not just look pretty because they're colored. So that's where we're at. We are also starting to be a little more strict on our timing with the business office. We closed the month on the 4th of the following month. That is, last month was our first close. And we didn't hit our credit balance reports, we didn't meet all of our self-pay phone calls. So it is a work in progress, and that's fairly normal when you haven't had a facility that formally closes anything. So I was really happy to see that all the department managers that were concerned about it, we reached out to Epic. They're all automated, so they don't particularly have to do any additional work to get their charges in. We'd just be able to look at them, like if the lab, we've got some outstanding charges, are they because we're waiting for cultures to come back, results, something along those lines. Those are all explainable, and it's just part of doing business. So that's kind of where we are right now. So if you have anything you want to see, please let me know, if something that is of particular interest to you.
So I have a question that doesn't have to do with reports, but so did all those reconciliations, are they finally
Done. Except the $1,700 I couldn't manage to get
So
in.
that's when we were
February.
talking about that, I was pretty excited, because I'm like, that means all the reconciliations are done.
All the reconciliations are done, and right now we're just correcting some postings. Like, when they changed from Meditech to Sage, they didn't necessarily change their process. So they're still posting in accordance with old general ledger numbers, and so they're not the appropriate ones. So we're just working through those. We've got the majority of it done. The depreciation schedule is done. Recording of the lease for the Omnicell is done on books. So it's getting there.
Good job.
Could I ask you to do maybe one thing, just for the benefit of people who may be watching?
Sure.
So the inventory system has been a matter of public interest. And I understand what you're saying. I just want to make sure we're communicating to everybody. So you said, 4 to 6 weeks to go live. Can you elaborate a little bit on what exactly that means?
Go live means?
Yes, and why that's a really positive development?
Sure. So in order for us to utilize our inventory system, we had to do a couple of things. We had to get all the pricing in there. So when the business office requests a case of paper, there's price in there that goes to their department as an expense. That is now completed. We have activated all of the inactive accounts that were put in there. So what it allows us to do is to maintain an inventory, appropriately charge our departments, and appropriately charge our patients. So that's where we're at. Whiffley has everything that they need to the best of our knowledge. We're going to find out if they have any outstanding. And our 4 to 6 weeks started March 2nd when I returned everything to them. So we'll be able to tick that off the box.
So our inventory, our non-billing issue for inventory should be behind us in 4 to 6 weeks.
We've been doing it by hand.
Assuming then all the employees that were involved with that there's a lot of employees that had a big hand in that, right? besides yourself?
Myself and Jason,
Yes.
and Chris and Stephanie. We sat down, we said this is what needs to happen, and everybody really pitched in and went the extra mile to make sure that we could get it. So
And Wendy, the project manager.
Wendy, the project manager, just kind of looks at me and goes, more? I guess I need more stuff done. So she has been a real trooper and willing to lead that, which project management for an implementation for software is not always a kind process. So she's been very supportive and very responsive to our team.
So that's a great development. I'm very proud of all that work. That was a really tough thing to do. So that will be a good revenue pickup for us going forward. And Miss Kathy, the Finance Committee had discussed another really positive development with the inpatient pharmacy that we said we would mention.
Yeah, that had to do with, they did some work to make sure that they were getting ahead of certain pharmaceutical drugs so that before they expired, they would send them back to the manufacturers, and then what would happen is we have a cost savings off of that. So we ended up with a cost savings of $70,000. We still had a waste value of $14,000 because they don't give you always the full price back. But we actually had a really nice savings from that. And that has to do with having our new pharmacy director really on top of things, Suzanne. So she's done a great job. And I was proud of her because she also had a flow sheet. You know, I'm into the show me your diagrams and stuff so that we can see what you're doing and so that they can see what they're doing. It really makes a difference. So she was excited. Look, I think I've got something here for you. Yeah, that's a big something, $70,000 savings. So.
And that was just in a quarter, correct?
Mm-hmm. Yeah.
Mm-hmm. So more good news.
How do we handle charge accounts at our local businesses? For instance, let's say the maintenance crew needs weed and feed for the lawn, and they go down to...
They go down and get it.
Is that okayed by anybody, or is that just...
Yes, we have an okay process.
Okay, that's fine.
Typically, they have to let at least me know.
Yeah.
So, and we found out inadvertently that we hadn't updated our list of people who could charge on an account, and so they were declined. So they called, and it was nice that the checks and balances were in place. But yeah.
Well, I'm supporting our local businesses.
Absolutely.
You know, fertilizer for the lawn, or weed and feed, or whatever. You know, little things that you normally don't.
Yeah, typically they send us an invoice at the end of the month. Sometimes they get a receipt and they bring the receipt back, but a lot of times they invoice us for it, so.
Good.
Yeah, and then we get to.
As long as there's a way to handle it.
We checked the invoice against the statement and see who signed it and what they done.
Very good.
I'm not going to get a new pickup again.
Sorry.
Okay, so any more questions? Corinne, did you have questions for Tish?
I don't have questions, but if you guys are done talking about the screen sharing, it's a little easier for me to follow if you guys take that off so I can kind of try to see who's talking on the video.
Yeah, we'll probably have to share a screen a couple times, Corinne, but other than that, we won't, okay?
Right, yeah. And that's fine, because it helps you when it's up there too, if you're talking about it.
Right.
But yeah, it's just a little easier for me to follow if I can kind of see who's talking, although it's way better down. Even though it's only one speaker, so the ones of you that are a little further away, it's a little hard to hear, but all the scratchy is gone in the new one, so that's very nice.
Very good. Okay, so are we good for Carrie to go next? You're good, right, Tish?
Oh, yes, absolutely.
Yeah. Okay.
So I just had a couple of things to add to Tish's finance report, and that is, Ann asked who Jason was. Jason Baer is our new inventory manager, materials management manager.
Yes.
B-E-A-R?
B-O-Y-E-R.
Boyer.
Oh, boy.
Sorry, couldn't read my own
That's
okay. So there's that, and then as Tish alluded to, we're very close to actual financial reports. She gave us an initial P&L and a balance sheet just for us to look at the formats and things like that, and those with the inventory coming online, that makes it much closer to getting actual department level reports. So that is a huge step, and we are grateful and really excited about the progress. One of the things Nathan brought up in the meeting was that it would be really nice to see a snapshot in time of how much money that we have in the bank and how much is in our endowment, like a once a month thing. So Tish has worked on some additional reports to add, like basically, you know, when you look in your own checkbook on January 1st and you see a balance, that's what Nathan wanted to see for the hospital.
The new store. This is the one-stop shop. We have a pharmacy. We have a bootlegger's liquor. The deli, the food that you can get at a lunchtime is so amazing. The coffee shop. Certain Friday mornings, there's 30 people sitting here in all these chairs. This is the hub for people to come and visit, have their coffee, have their donuts. It's amazing what this area has done. Totally amazing.
You know, when you look in your own checkbook on January 1st and you see a balance, that's what Nathan wanted to see for the hospital. And I think that's a worthy goal for all of us as the fiscal oversight board for us to keep an eye on as well. So that Tish is going to include that in future reports. And that's all. We're just excited to see the progress. So.
Okay, so we have we have David here. He's going to do a quick overview of the community health needs assessment because you all have the report, but he's just going to do a presentation to kind of get to the meat of it, okay? Let's see.
Wonderful. Can everybody hear me?
We can
Yes.
hear you.
Yes.
We're just waiting on a screen, I think, so let's see. Are you going to let him share the screen? That's probably what you
Let's see. Do you want me to just show what I have on my screen? Would that be easier?
Yes.
Yeah.
I see you at least.
Okay, let's see.
His name
Oh,
is
wait.
David Sandborn. He's the person that we hired for the community health needs assessment. Thank you, David.
All right, you can see that okay?
Yes.
Okay. I'm going to pull another one over here just for a quick recap, and I realize that, you know, you guys probably have a long night ahead of you, so I don't want to take up too much of your time, and have plenty of room for questions if you have it. You've all seen the community health needs assessment, I understand. And so as we go through this, just, you know, the process went well. We had, we came out with 7.
David, do you think that you want to put yours to a fuller screen maybe because it's pretty small? Or is that about as big as it gets? Okay, there we go.
I just have two, so I was trying to figure out who's
Okay. So, as you turn to the back of this, on page 26, you'll notice this is where we start to go over the findings from the community health needs assessment. And basically there were 7 areas that we talked about. So specialty care, care coordination, senior services, mental health, marketing and outreach, extended clinical hours, and actually there's the veterans affairs came in at the very end too. So let me just shrink this down, and again, we just want to go over okay. Well, that's not going to work, is it? It's showing on my wrong screen. Basically, what we came up with was this all can be summarized into 2 categories. As the hospital, we're looking to improve services for the community and improving the perception of the hospital in the community. So when we think about that, improve services in the community, the first thing that we're going to do is grow and strengthen our specialty services. So we want to take a look at some of the things that came out of the health needs assessment. So psych was a big one that came out. There was a call for dietary, as well as mental health, pediatrician, orthopedics, cardio, endocrinologist, ENT, women's health, and dermatology. So these are all specialties that over the next 3 years we're going to be looking into seeing which ones need to be strengthened and or added to our services here at the hospital. The second category was improving care coordination. In care coordination, we're talking just about that patient journey and how we're helping them through that process. So we wanted to create a patient-centered medical health program where they are looking at Weston County as their hospital, their place to come, and then we help manage everything as we can take care of it, or they may need to go somewhere else. We always want them thinking of us as their home. So that included creating that medical home program, marketing that program, and also coordinating with outside organizations to support that program so that we have good partners in the area. Then secondly, or thirdly, I guess, we wanted to improve our services for our seniors. We know that that's a growing population that we have, and so we want to make sure that, and it came out as a big concern in the community health needs assessment. So making sure we have a home health program, end-of-life care and hospice, and assisted living and caregiver relief support. These are all areas we want to explore again over the next 3 years to decide what we need to do to improve or strengthen these areas or even bring them in if that's the case. Getting back to mental health services, we talked about psychology as well as mental health over here, but some of the breakdown of that was making sure that we had a good resource for suicide prevention, bullying, substance abuse, and general mental health. Those were some areas that came out, especially when talking to about the youth. And also, if I remember right, we were talking about the fact that suicide is not just among the youth, but we have other people that we might need to have under our concern. Finally, or next, I should say, we went to improving perception in the community, and that came down to 3 things, basically. We needed to have a good marketing outreach program and public perception campaign. So this is, in looking at this, is serving the whole family, marketing services that were highlighted in the CHNA, those services we have over there. But also, within this, finding really, one of the things that came up was we need to find out who the main decision maker is. Another hospital had used the word, I think they gave her the name of Maria, basically the person over the family. And we wanted to find out, who is it that really is in charge of healthcare for the family? How do we attract that person and make sure that they know and love us so that we can continue to serve not just that person, their spouse, but also the whole family, children as well. We want to consider developing better resources, especially with our VA, to take care of our veterans in the area. And then finally, explore the clinical hours and extending those. So is there an opportunity for us to extend those clinical hours so that we, again, build that perception in the community of Weston County is here for me, and so that's why I'm here for them. So that was a real quick overview. Anybody have any questions?
I think basically the things that I would just mention is the physician recruitment piece that we're working on for specialty clinics. We've already started that. Community perception, we've got our marketing piece that we're working on, and the stuff with the school is kind of interesting. It's actually the school schools that, people that answered said that kids are really being bullied, and the suicide rate is pretty high in this area, believe it or not, and that's among teenagers and even like rangers and that sort of thing. So we were surprised by that. We don't find us to be that solution necessarily, except to get people to the right resources and stuff. So some of this stuff is going to come through partnerships relative to us solving the problem all by ourselves, and some of it is coming directly from us to be able to do that. Thank you, David.
Thank you. If there are no more questions, I'll invite you back to your meeting. I hope that was helpful, and again, I hope you enjoy reading the community health needs assessment. The one last thing that I would say is kind of, since we had Allison on talking about all the legal things, that with board approval, if you've not approved the community health needs assessment already, that will need to be posted by the end of your fiscal year. So that and then of course with accounting, getting that all that noted on your 990 form. Those are the last two requirements from the IRS on that. So as long as that's taken care of, if you have any questions between now and then, or we need to change anything in there, let me know.
Thank you.
All right, thanks. Have a great night.
Thank you.
Bye.
So this is up to you. Thank you, David. This is up to you, but we gave you the whole packet of it, that information. We've actually went over it with a certain amount of the group. It's whether or not you want to look at it one more time with our thing before you pass it, but basically it's just a matter of approving the community health needs assessment so that we can put it into the packet to show that we're in compliance relative to the requirements that we have under Medicare.
What would you recommend we do? Like, so we talked about it briefly
Well, what
when it first came out, and now we've talked about it briefly.
What we should do is look at what we're going to do for strategy still, and look at what complements what we need to do, and then what other things we may need to do instead of those things potentially. So the only thing that I think is left is taking them and turning them into an actionable item, but that's not required in order to approve the community health needs assessment. So we met that part of the metric. It didn't go as smoothly as I would have liked it to, but it did go. And I learned some things from that. I've never had quite that experience. It was a little rough. But I think that the report is good. It looks good, and it's doable for us to say these are things that we're working on in the community. At some point, I hope to be able to either try to marry some of that stuff up with the collaborative that's in town that I don't really know a lot about yet, but to see what we can do to work together as a community. But we did get insight from the community on what they want.
I think we will use the data that was collected in our strategic planning in the future.
Right, exactly. So that's, to me, that's what we do with it next step, but that doesn't prohibit us from accepting the community health needs assessment. That's just how you see it. It's 27 pages or something like that. So I don't want to read the whole thing to you. Hope you don't mind that. That's why I put it in your packet last month, because that's pretty big.
So what do you guys want to do? Do we want to pass that now, or do we want to wait till everybody's, does it feel like you've kind of given enough opportunity to read it? What's the...
I've read it thoroughly.
I agree with pass it down.
Thank you.
Okay, so...
You can always bring it back to strategy, that's what.
Yeah, we probably will bring it back to strategy.
Right.
Do you have an opinion, Kareem? Are you ready to vote on this?
Yeah, I can vote on this.
I believe it's 33 pages.
33 pages. I can't remember, I know it was 27, 33, there's some pretty pictures in between, so.
Okay, so if anybody wants to make a motion, they're welcome to.
Madam Chair, I move that we accept the word lost.
Community health needs assessment.
Community health needs assessment. I was trying to fix the headline again.
Okay. Any more discussion? All those in favor say aye. All those opposed, the same. Okay, so that has passed.
I forgot to mention, David did say he would work with us for strategy, but I think we're gonna work with Tony through all that other stuff we're doing, so I'd rather set aside the strategy part and just keep with the report with when it comes with David.
Nice that Tony knows us.
Yeah, exactly. Okay, the next one is physician recruitment. So what I have contracts out for right now is Dr. Sylvia Trotter for podiatry for the nursing home, Dr. Eric Sawyers for nephrology, Dr. Daniel Christensen for EMT, Dr. Brenda Engel for behavioral health. What I have contracts out for right now is Dr. Sylvia Trotter for podiatry for the nursing home, Dr. Eric Sawyers for nephrology, Dr. Daniel Christensen for EMT, Dr. Brenda Engel for behavioral health. We go from a half day to a full day of counseling for every month.
And do you think you'll be able to use it? Do you think people will use it?
They're busy enough that they won't go from half day to full. So, yep. I think you say that they're part of podiatry. Christensen is EMT. And Angel is behavioral health. And Dr. Sawyer is nephrology. So that's a pretty good group of people. And yeah, is she Echo? Is that what you're talking about? She comes every week. Yeah, behavioral health comes every week and wants to go from a half day to a whole day. And then we're going to be adding additional echoes for the heart. So that we'll be doing that 2 times a month instead of 1 time a month for patients with cardiology work. So that should increase our revenue as well. Okay. And then I'll tell you later in executive session, but because we want to talk about contract, but Dr. Craig McCurdy does want to come to work here, and he is giving 90 days notice to his job and needs 30 days to move into his house he's found around here. So he found some house with some acreage and 10 minutes away from here, so he's looking forward to come. And he said good luck tonight, so I guess he's counting on you guys to let him in.
I know these are going to be the most busiest, but also the hardest to recruit. Any word on peds and OBGs?
Peds, Dr. Ulmer, Ashley Tupper has Dr. Ulmer going to peds. So that happened. And this, I can't explain it. So just know that she decided to go with Ashley Tupper's clinic to do pediatrics.
Oh, so it's a...
Yeah, she's in town. But
she went with
pediatrics, but she went with someone else.
Oh, I didn't know we were recruiting. I mean, that we had. Okay.
Okay.
Who was
Yeah.
that?
Oh, I tried. I called her. Peds, Dr. Ulmer, Ulmer. And then I have not worked on the GYN for a little while, so I need to get that one done, but just haven't had time. To be honest, it took a little while for us to get our contract. We've updated the contract so that it makes a lot more sense to get our square footage piece, do fair market value work, and make sure that we offer the right price for the rentals. Yeah, and actually start collecting money too. I actually had somebody call me and say, you guys haven't been billing us for our rental space, which we have to do, so anyway. This is just for you to think about. This is nothing to, I don't have a cat in the fight or whatever it is, but I did want you to talk about hospital district election timing, May versus November. So deciding when you want to actually do your election for that. If you do it in November, it's with the bigger November voting time. If you do it in May, it'll be a special set aside.
And it'll still be still be a special one in November, but we probably will have more people. So
it's just something for you to think about, so that we do everything we're supposed to for the timing of everything, all the notifications and all the.
So I just have
go ahead, Kareem.
Yes?
Currently, it is in our bylaws that it will be in May, so that will be something we have to address in the bylaw changes if we're going to change the date.
Okay.
Also, in the bylaws, it says you shall serve 4 years.
Yeah,
So that either extends you to 4.5 years or shortens. It would need to be a bylaw change. I would think that because you were elected for 4 years, I was elected for 4 years, it would take agreement that all the board members to agree to that.
For that
Because
year.
you were elected with the understanding that you were going to go for 4 years or finish out a term.
Selfishly, that was my first thought about it, of, will I have to serve till November? And I was going to be let go in May.
But just throwing that out to keep that in mind when we.
Why, can I ask, why are we talking about this?
The only reason we're talking about it is that Denise brought it up because we have to start looking at timing for things, and she wanted to make sure, I think, I can't speak for it exactly, but in the special district handbook, not the bylaws, that is what you're allowed to do. You're allowed to do it either in November or May. So it's just a question to present. Not that I personally will do whatever you guys want.
And so mostly it's just to get us thinking about it. We don't have to make any decisions right away. Probably need to decide before we finish the bylaws.
Question, in the past, because I don't remember, when we did the last election, did we have just the polling place at the library, or did we do one in Upton and Osage too?
Yes.
We do 3. We do one in each community.
Because if we changed it to November to time it with the elections, we would definitely have to have 3. So, yeah.
We do one in each community. Even during COVID, we did.
So Denise, when we talked about it initially, Denise had thought that we might be able to save on expenses because we wouldn't have to print our own ballots and that kind of thing. But because we are a special district, we will.
Yeah.
So we don't get to save on those expenses, and it would be run sort of like the fire district thing. So the hospital would have another table in the polling place, and you would have to cast your ballot in the regular election like you regularly do, and then you would have to go to the other table and get your hospital ballot. So
it's very interesting because every board I've had before this, no one else would go run for the board, so they had people that had been on the board for 30 years. I'm not even kidding.
Yeah,
so
it's been how it's been here too.
Yeah, so.
And just food for thought, that if we do continue the special district in May, I will look at a different venue other than the library because it got pretty crowded at the end. And it hasn't happened before, but we had over 200 more people. So, but we would look at a different venue for sure.
And so what's the deadline for when we need to make a decision?
I start in December of this year to start preparing and getting ready for the election.
Thank you for lots of advance notice.
So Charlotte's here now to wake up a little bit. No, I'm just kidding. We're so exciting. She wants to demonstrate our video that we have now, nursing home video.
Here's the video.
And we're still sharing.
Great job.
are you demonstrating?
You want to go to the full screen, and are you sharing? That's the big thing. I'm sharing. Uh-oh. I just lost it. There you go, banana. Right there. Right there in front of me. Oh, it's a really good, it's really good.
I've been resident here for a little over a year now. This place is full of everybody. You can tell people that like to be with old people because they really take care of you good. And they're very kind. I was living in Newcastle, Wyoming. There's no audio on this. We had 2 days, 2 hours, 2 days a week. And my son came up with this place, and because I'm over 65, I'm a vet.
So, she might, yeah, that's what Corinne just said.
Corinne, you can't hear it?
That's correct. There was no audio with the video for me. I can see it perfectly, but there's no audio.
You'd have to hold the mic up to the TV probably.
Oh, yeah.
Oh, that's because it's cold back there.
It's probably okay. I can view it whenever.
It's really good. The audio adds a lot, Corinne.
I will
I'm sure it does, yeah.
Corinne.
Yeah, we can forward it to you for viewing later.
Service connected disabled. Comes me and never regret. Today, every day, activities people have an organized activity that's always interesting. Everybody loves to play bingo. We play it 3 times a week here. We also have ceramics that you can paint and pictures that they show you how to paint. Teach you how to paint them and stuff. But it's amazing that you do end up learning how to paint. I haven't witnessed or had perpetrated on me anything that was not first class.
So that one you can really give to somebody to look at, that's looking at whether they want to come here or not. They can be able to see the whole area. We can also use it for marketing by splicing it a little bit and making it a little bit shorter. So, really proud of the work that was done. Let's see, the next thing, I wished I would have thought of this, but I wanted to mention lease versus purchase proposals for replacement of computers. They're both the desktop and the tablets. In the past, I think we purchased them. That's what I remember from Wendy. I'm talking to Wendy here. And she's now looking at whether or not we should look at a lease proposal. And there's a couple of reasons why. Number one, we're getting to the point where we need to replace computers. We've had some just completely burn out. But secondly, with the Terra 4s, we're concerned that we won't get some computer replacements without a lot more expense going on potentially. If we don't have some sort of plan in place for replacement, that we would already have a guaranteed number of computers and stuff for us. The leases are two different ones. That one's a desktop, the desktop ones, and one's the laptops. We actually have a total of 96 options, I guess I'll call it, so that we have 60 that are mini desktops and we have 36 that are the laptops. Mainly managers and directors and above are using the laptops. Desktops are done with most of the nursing and well, they have some rolling on the wheels too, but people that sit at their desk all the time have desktops. The advantage of this type of program is that you get a warranty for the full time, and then when it's time for that 5-year warranty to wear down, you just would go with a lease again and be able to get new computers and pay for them over months, basically. So if you look at this, it's basically it's about $3,100 per month, because for the two different sets, you would lease that instead of paying for them straight out, right, as far as trying to pay a chunk of money on getting these. You also have the ability to be able to replace something if something goes wrong because you have the insurance with the warranty that you can replace the equipment. If we were to buy them ourselves, we're basically just going to take this same amount of money times 12, basically, and you have to spend that over time to be able to get the computer.
So how much is it? 5 years?
Mm-hmm, 5 years.
How much does it cost to replace the computers?
I need to take the numbers, and if you were to take this 1531 and the 1625 and times it, each one of them by the number of computers I just mentioned, I don't have that calculated out, sorry. But it's, I can calculate it real quick.
Do the computers have any value when we're done with them in 5 years?
No.
We just junk them?
They just were pretty much chunked by that time we do that anyway. They just pretty much go out.
1937.
1937 per month.
So if you had 96 computer, $3,100 a month times 60 months, divided by 96 computers is $1,937 a computer.
And how much?
For
5 years?
Every 5 years.
Including the warranty and the
Yeah.
insurance, right?
It's not that
So
far.
that's 19 for a computer for 5 years.
Correct.
So did you
And
say
to buy an
3,100 per month
average computer
Yeah.
for the
outright,
whole thing?
$1,400. Yeah.
So it'd be cheaper to buy them outright, but we don't, but it's
You
a lot
wouldn't.
less hassle.
Correct, but you also wouldn't have it, this is a guarantee that you're gonna have that computer and it'll be working for 5 years. If you buy it outright, there's a chance it.
Right, and you
For
can.
5 years, and you might not be able to replace it.
And most likely you would need to buy the warranties for them anyway, because we want to probably have a warranty on them if we had them in the first place, because we don't want to have no warranty, but we won't get a 5-year warranty most likely. We probably get a 2-year, 3-year at the
And then they'll
most.
break down at 2.5.
Mm-hmm. So, sorry, I should have been more prepared with calculations, but,
It's okay.
you know, but,
Give me something to do.
Kathy, were you able to do the maintenance on those computers, or did they do, is that part of the?
that's part of it. If there's anything wrong with them, they basically replace it. So we don't have to do the maintenance on them, other than the stuff like, we don't know what we're doing. That's a different problem for, but basically it's a way to be able to have the computers exchanged out if there's something wrong with
And you
it.
have to think that half of them are laptops, which the chances of a laptop lasting 5 years in an environment like this is.
One was 5 and one was 3, wasn't it?
Yeah, one was, no, I don't remember it being 5 and 3. I think, are you thinking of the?
No,
This is 3-year, oh yeah, it's 3-year warranty on laptops, because they won't even go any further than 3 years. Sorry,
1937.
and 5-year on desktops, thank you for remembering that.
So the 3,100 per month is for how many months?
These terms would be the same amount as the warranty, so it's 36 months for one of them and 60 months for the other one. So 5 years on the desktops, 3 years on the laptops, and then you're back
So
on
that
the.
changes it.
It does change the
That's
math.
bigger math.
You gotta do it twice.
You wanna look at it and see?
For desktops, it's 5 years
For the laptops, it's 3.
So for the first 3 years, it's 3,100.
Mhm. Yeah, and that's me doing rough math. It's some change there in the change, but it's 15 and 16.
How soon does this decision, sorry, Tim,
Oh, man.
how soon do we have to make a decision on this?
You don't have to make the decision today if you don't want to, but I will tell you, we're starting to have computers fail on us, so we're looking to try to just get ahead of it. And however you believe about the tariff wars, there is a chance that we'd have some problems with chips and that sort of thing, and getting stuff from other countries at a much higher price than what we're quoted right now.
How would we handle a computer that has been used in the hospital and possibly having confidential patient information stored in a file on it?
Wendy
and
does
turning it
things to
back on?
scrub all of them, so they
She
all
can
get
scrub.
scrubbed. Plus, we have a vendor that we use that does specifically those things with that type of equipment. We pay them to take those and make them not
As
use.
long as there's a
Right, yeah, there's a process.
reasonable process to go ahead and get them wiped, scrubbed, bleach fitted, as Hillary said.
Thank you for,
They
Smash
usually,
it with a hammer.
they usually just smash them.
Well, I grind them, but you know, there's always a chance of a computer being out there that hasn't been. Especially, well, even in these that we take, that if we replace them, making sure that they get to the right.
yeah, no, we have to do that by HIPAA laws, so we have
Sure.
a very big process for that.
That they're not given
So do we have
to.
a actual?
That's, Carrie's just about got it, I think.
Yeah, sorry, guys, I blew that.
No,
You've been busy.
I have been busy, but I still should have came with more math.
I tried to get my head going.
So what I'm coming up with is, if we lease them, we pay $152,000. If we buy them at these prices, it's $144,000. So that little extra of $8,000 is, you're getting the insurance and the replacement
Right.
and things.
Steady routine, turn it over.
Right.
Yeah,
So it's a very, I'd say $8,000 over this term is a pretty good deal to have we wouldn't need very many computers to break or have problems for that to pay for itself.
right.
Probably would have had that many broken in this period of time.
We've had I've noticed an increase in the number that are failing recently, so since I've been here, we've bought computers.
No, I'm good. I'm trust your.
Is that in Ryan?
I might have the numbers.
I think it's the,
Kathy, how many laptops and desktops?
there's 60
Desktops and 60 laptops.
laptops. No, it's the other way around,
That's right,
36
yeah.
laptop,
Okay.
desk,
30.
there's 36 laptops and 60 desktops.
Okay, that makes more sense.
Oh, no, oh.
Yeah, that makes more sense to me, because I was coming out with $2,700 per desktop and $900 per laptop, and that just doesn't,
So it's
the math wasn't working.
60 desktops.
Yeah.
The only thing I will say, because this is what these vendors like to do, I usually can get them to do something, they put this as a proposal that expires at the end of the month.
So what I looked at on those pages is it says, here's the cost to buy it.
Right.
Here's the amount per month, the number of months to lease it. So I just multiplied, the 36 by the whatever, and those were the numbers I gave you, so I think it's.
Is there a brand name on these computers?
Well, it's the ones that she's been using, Lenovo ThinkBook
Okay,
and-
that's name brand.
and Lightspeed Performance. I got no clue what that is, but those are the ones we've been using.
It's not that.
So Ben, do you think we have any problems with Lenovo? No? Okay.
Okay. So are we?
So the prices aren't really that bad.
Okay.
So it's $1,620 per desktop and $1,531 per laptop, which is not bad
Right, it's a very small price to
for
pay.
the insurance portion of it, like you said.
So, I personally think that we should just make a motion and move forward on it. Is that, Kareem, where are you at in all this?
To go with the lease rather than the purchase, right? That's
right.
Sorry, I had found my mouse. Yeah, I'm happy to go ahead and vote on this if you'd like.
Okay.
Thanks for your additional.
And I would be in favor of the lease option, I think.
Okay, so, if anybody wants to make a motion.
I move that we give Kathy the authorization to sign the lease commitments that she's shown the board for both the laptops and the desktops for the amounts on those amounts or for more favorable amounts if she can negotiate that.
Do I have a second? Any more discussion? So all those in favor say aye.
Aye.
All those opposed, same. Oh, Ted, sorry.
No, you go ahead, finish your
Okay,
motion, carry or whatever you want to say.
Okay.
Oh, oh.
I'm like, oh no, there's
So
discussion and we voted.
Did you vote yes?
Yep.
Yeah.
Oh, okay.
Yeah.
Okay,
Okay,
this has a question.
Oh, I got you.
A question of privilege while we got a break?
Oh, yes.
Then we take a
Yes.
10-minute break.
Yeah.
Well, I don't want to stop. Going.
Kareem, it's not very nice unless we're having pie without you.
It was really good too.
I do think one of you should run me a couple pieces
You should tell Brad, I'm really sacrificing here.
Yeah, I for sure am.
So, just to keep you informed, the Blue Cross Blue Shield, it's called Wyoming Blue now, is what I'm hearing.
Yeah,
It's
that's what
Medicare
it's
Advantage. And they kind of, they called me a few months ago and we weren't ready to talk to them about that too much at the time. There was a lot of conversation going on, even in the Wyoming Hospital Association. But I have their information and they're letting us redline any of the work in there that they have. Their prices aren't that bad when Kish and I look at it. It's within 1% of Medicare, so the prices aren't too bad. So they did say to us that they were gonna do it with or without people, but that's really not true. Then they haven't signed anybody up yet. They're gonna start this in 2026. But I do think we should sign up with it if they do that
What
in
would
this
be
area.
the term of this agreement?
The term?
Yeah.
I've just read, I think it's 3 years or something like that.
It's 3 years and you have a 90-day out.
Yeah.
We can get out in 90
I know,
days,
but
yeah.
at the end of 3 years, are they going to give us less favorable terms?
Yeah.
It's very
Of
possible.
course.
Mhm.
Yeah, more than likely, yes.
And I don't know whether people will sign up for it, because here's the thing.
Right.
We can either market to say there's no Medicare Advantage to Medicare Advantage here, because we feel that there isn't. Right now, if somebody signs up, and there are a few people that make that mistake, they sign up for Medicare Advantage, and there's no Medicare Advantage in this market. So it's looking at that. So I was gonna do some red line on it, but I wanted to make you aware of it and see what you guys thought. They're controversial because they're historically known, especially United Healthcare. Sorry to say that, but they're notorious for saying that they basically don't pay well. That's the line.
The
Bottom line.
problem is the rationing that they do. When you sign up for Medicare Advantage, you sign up for rationing. Even though they tell you they're not, and we're gonna add extra benefits and yada, 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 but they ration. And if we sign up for it, I feel like we're encouraging Medicare Advantage, and Medicare Advantage, no matter what they say on the TV and all of that, it's bad for the patient. It's just bad for the patient, and they get sucked in, and their care ends up suffering. It's
Well, and
bad.
we would be sort of perhaps
Implicitly
encouraging people,
yeah.
you know, to say, the hospital, accepts it, I'll sign up for it.
But if we don't sign up for it, in a lot of markets, they're just, like United Healthcare, in a lot of markets, they just opened up to PPO plans, so.
Okay. Well, so I'll be carefully looking at that, but, and I don't know what to say, because it's been about now, it was 24 that they started talking to us about it, it's gonna be for 26. They said they're not gonna do any pre-authorizations for stuff, but they're famous for pre-authorizations. They said for the first year, they wanted to study the market and see what people are doing, and then I'm sure they're gonna lock in a bunch of pre-authorization requirements. That's what I think.
So what's the legislative relief look like, if any, on this topic? Is there any talk at all? Do our lawmakers just like this or don't care, or?
The problem is Medicare Advantage is federal, so our local lawmakers have no.
But it's not Medicare, right?
It is Medicare.
Well, but when you sign up for it, you don't get the regular Medicare.
No, you don't get the regular Medicare.
Right,
That's
and
correct.
so
Shadow bill Medicare.
you're leaving the regular Medicare system, but people don't understand usually that they're making that choice, and so it's a very deceptive practice.
So do you think that it should be?
Well, I think they should call it something other than
Medicare Advantage.
Just call it something, leave the word
Replacement.
Medicare out, because people don't
Replacement of it.
understand.
Replacement.
They're giving up their regular Medicare for something that's really not Medicare, and the whole point, it seems like, from what the little I've read on it, is it's they're just finding a way to make a lot of money for themselves by denying coverage or not paying the hospital much. They're just creating a spread where it doesn't need to be.
And so they're getting the Medicare payments from the
Well,
government.
I'm not sure about that part of it.
Yes.
I just know that you're not on actual Medicare if you switch to Medicare Advantage.
And if they take that out, then if they take the word Medicare out of the Advantage plan,
I don't have a
then,
problem with that.
but they aren't gonna do that because then people aren't gonna buy
Right,
it.
and so people are being tricked
Yeah.
and they don't really understand what they're doing.
Well, I think a lot of people believe it's Medicare plus something.
Right.
Well, they're being told that they get everything they get with their regular Medicare plus other advantages.
Eye
What they
exams,
don't,
free rides,
right,
gym,
but what they don't
dental.
realize is
Maybe.
that they're also signing up for
Maybe.
their care to be rationed
The
by
doctors
an
always have to be
insurance
under
company.
that plan.
I can give you a million examples, and probably Tish can give you a million more, of people who under regular Medicare would have got great treatment, and under Medicare Advantage, their insurance company denied that treatment.
Right.
So.
That is the challenge.
Yeah.
And they said, we're gonna go with you or without you, and it's kind of like, I was thinking about the hospitals around us, and I was like,
But so what they would do is offer the PPO option in the market. So they would still try and get people to sign up. I mean, Tish's point is a good one in that if they do sign up and they get sucked in, if we don't become a participating provider, there's a chance that we don't get paid at all because their care is denied, and then we bill the patient and they can't pay their bill.
Yeah, we're not in network.
The only bad situation I'm thinking of that I would really like to avoid is, and I don't think it's really the board's decision, but I'm just thinking out loud, is if we do sign up to accept Advantage, then inevitably people will sign up for Advantage plans. And then after the 3 years is over, if they give us very unfavorable terms, then we're locked in, and it's like, oh, we've got all these people in our community that are on Advantage, and we can't get out of the deal, and now we're going to lose huge sums of money, and our friends and neighbors won't get the care they should have. So that's kind of my tentative thinking on the topic.
To build on that, I mean, we're seeing our home health has problems with the Medicare Advantage plan, and people who would normally get home health are now on a Medicare Advantage and they can't get the home health. So we go out in the community and we tell people don't sign up for Medicare Advantage because you're gonna get more benefits under regular Medicare, but then we go and sign up with an Advantage plan.
I get what you're saying.
I don't know if
I think
blurs
it's
our message. I don't know.
Well, it would, but I think that we have to decide what we favor. I think that I do need the thoughts of the board too.
I would not sign up for it.
Okay.
Just because it does a very large disservice to anybody that signs up for the Advantage plan thinking that it's better than what they've got. It in most cases is not better than what you've got, and I wouldn't want to be responsible for encouraging anybody to make that choice.
So I get that, but
Ryan's got a hand.
oh, sorry, go ahead. Go ahead, Kareem.
That's okay. I'm agreeing kind of with what both Carrie and Nathan are saying, and I also don't want them to be able to market it to patients in the community saying, well, your hospital will accept it here. They've signed up because then it looks like we're encouraging that. So I'm pretty against it, and I think our message could and should be that this isn't good for patients, and so we're not in favor of it. That's my opinion.
Yeah, when my dad called me, he asked, and I looked into the topic. I said, whatever you do not sign up for Medicare Advantage. So if I would do that, if that would be my advice to my dad, that would be my advice to him. Don't do it.
Thank you for your feedback and no, I'm serious. And we, just so you know, we're kind of looking at insurance contracts anyway because we don't have some contracts we should have. So we're gonna work on that as well.
And I don't want you to get, personally, Kathy and Tish, I will defer to what you all think is best for this market and this hospital. I know you'll make the best financial decision by looking at the numbers, but just personally, and maybe my hatred for the Medicare Advantage plans is covering but I trust you to make the right decision for the hospital.
I'm not a big fan of Advantage plans either. I'm just trying to look at it and see what they say.
That's
and
fine.
I actually,
I'm not gonna criticize if you decide to go in the other direction.
And I can just touch this. My intuition is telling me it's when you said, oh, it's just 1%. I was like, well, no, they're famous for it being way worse. So even if it is 1%, then once you sign up and people in our community sign up, we can't take it away. Then they've got us, and then they can give us less favorable terms, and that's really, So I don't trust the whole.
What happens if you show up in EED and that's the only insurance you have?
What? But you're only but we'll.
You're out
We
of
deal with
network at that point.
Right, but we deal with that situation all the time.
Yes, no,
right? We deal with people that come to the ED and don't have insurance. We work that out. So,
There's a difference between having some insurance and no insurance, because if you've got no insurance, we can get you financial assistance, but.
My next subject, I'm having her make a print out of it, Denise, but I have talked now to 5, let's see, 1, 2, 3, 4. There's 5 companies that are willing to talk to us about the forensic audit. I have not talked to Durbin. Durbin kind of came late to the plate to say that they maybe would do that. I actually think they might be a conflict too, to be doing that because of doing our books part of the time now anyway. What I needed to talk about a little bit is, it seems like everybody that I've talked to so far, there's phases that you pay in stages, basically, phases of it. So it's either anywhere between 1 to 4 stages that they have, with tiers that they have for looking at your case, but they all pretty much sound the same. They basically do interviews, they look at they get document requests for review, and then they do the data and financial analysis pieces. They look for, they do a draft to give you a preliminary idea of what they think is there. Now, it may stop at that stage if they don't find anything that's shocking, I guess, or something that they need to address. Otherwise, it would progress. And what I do want to mention is the first phase of it costs anywhere between, I've been quoted, there was only one place that had a little bit lower price, but that's because they put it down as based on $6,000 for 60-day service if you wait 60 days to have the service, for them to start the service.
It's a 666.
It's a $6,000. But they also have a retainer's fee of $7,000, and they have preparation fees in 20-hour increments of $200 an hour. And if they were to go to court for some reason, it's $300 per hour. If it's in person, it's $450. So it's relatively expensive. When you talk to the other agencies, they're talking anywhere between $75,000 to $100,000 for that first phase. So it's a matter of, I don't have an hour yet. I don't have a scope of work that specifically says the hours, because they'd have to look at more detail from us yet to go far. I was just exploring this. I am exploring our insurance, because under our management liability policy, there may be some coverage for that, and in that policy to be able to cover looking at any kind of thing that might have been done, whether by accident or in reality, that they'll pay for. And our the policy looks like it covers it, but I'm not sure. So I need to really check on that a little bit deeper. I don't have that answer yet today. If it did, we have right now a $1 million policy, and we have $1 million for, let me see if I can drag that up again. We have $1 million for liability insurance coverage and employment practice liability coverage of $1 million. We used to have $1,500,000, but it's been raised to $1 million and $1 million. So if that insurance covered it, it'd be feasible, more feasible, in my opinion, to be able to afford it. If it doesn't, then you have to look at the overall cost comparison versus what you might find out from it. It really could conceivably cost as much as about $250,000.
that's only if they would find.
If they would
something.
find it, and they would go to court
So
and
how-
that kind of things.
Right. And so how much generally is the first phase, kind of that first look? What's the quote on that?
Well, I had a quote was $90,000 to $100,000 for one group. I had a quote $75,000 to $100,000 from a second group. And then that third group that has this quirky one where they do the per hour thing. So I don't have any idea how many hours I need to check further with them. my big thing is, I've got six people. I kind of need to narrow it down to 3 or so, and then try to figure out if we want to go deeper with what we are looking at for scope of work, or we want them to do some preliminary work, or where you guys are going with this, basically. Because I gave them the idea of the years we might want to look at, and I gave them an idea of why, because we're trying to look at some dollar inconsistencies and that sort of thing. But they kind of, well, at least to me, 75,000 to 100,000 is quite a bit of money to look at it.
But that's first phase.
Yeah.
Well, I still say it's money well spent. That's what I firmly believe. Even if it goes up to 250,000, I think it's money well spent. I hate the fact that this board got handed this at this point in time, but I think I would hate to tell the public we just decided it was too expensive to look and close the door on this issue.
So what about the timing? So we have all the documents, right?
Years.
Well, for the years.
They said, I talked to them about that, they basically would need the stuff from Meditech, so we have access to all of those Meditech reports.
So the data is not gonna go anywhere, we've got it. So, what are you thinking about the time? Should we wait until we get the hospital's business really well fixed and very stable and things are going well? And then pick this back up?
Well, even into the next fiscal year to budget for it. I mean, I don't think that's a problem.
I would be very comfortable moving forward with this if we really succeed in our most important mandate of getting back to fiscal stability and things are going very well. At that point, I think I agree with you that, I can't not find out, but I think at this time, it would be, there's no statute of limitation in Wyoming. Oh, Corrine, are you gonna say something? Oh, okay. So I looked into it, and for felonies, there's no statute of limitations in Wyoming, from what I can tell. Tell me if I'm wrong, Allison. So we have all the time in the world to find out. So I'm in favor of moving forward. It's just a question of the timing of when do you want to move forward.
I have a question, and this really didn't bother me. So you do the forensic audit, and you find that there is something that's happened. So then the person or people or whoever is prosecuted or found, whatever. What's our chances of recouping that money?
Well, we have the insurance policy that should pay us if we can't get it through court. What Kathy's saying is we're insured for their bad behavior. So one way or the other,
I need to double check the details, but that's what it looks like to me.
So one way or the other, if we have credible information by people who specialize in this to say, yes, somebody took such amount, then if we can't get it through court, which could be very expensive, probably the first thing we would do is put a claim in on our insurance policy.
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.
So one way or the other,
I need to double check the details, but that's what it looks like to me.
So one way or the other, if we have credible information by people who specialize in this to say, yes, somebody took such amount, then if we can't get it through court, which could be very expensive, probably the first thing we would do is put a claim in on our insurance policy at that point, and then it would probably be us. If we had to take anybody to court, it would be our insurance company for refusing to pay on the policy. But I do agree with Ben that this is a public institution, these are public funds, and that, you know, we've had, it looks like 3 years where we've lost maybe a couple $1 million each year. We have got to make sure that never happens again. And we have to know what happened. Why did this place run off the rails so badly? And how do we make sure that never happens again? And so this is one of just a couple possible explanations to explain what happened. So anyway, but I'm happy to wait until a more opportune time to move forward.
So Corinne, can you?
Yeah, I just wanted to say that I would like for us to potentially explore what the insurance policy does cover a little bit more. I'm definitely interested. Do they cover us if we have to prosecute an individual? Or do they cover us if we prosecute an individual and the individual can't pay?
Well, so there would be no cost to us if the county wanted to start a criminal prosecution. That's on them. Typically, these things go to the FBI, not the county, and so they would foot the whole bill for the criminal prosecution part. What we would be looking at is some kind of civil suit or going against the insurance policy. But at this point, I'd like to hear more about what our insurance policies covered for the time frame that we looked at.
Go ahead.
And also, I'd like to hear, you know, really, we have a very small, limited engagement. What would it cost to do some high level analytics and just start and just see what that would cost, and then we could go from there. And so surely it can't be $100,000 for a limited
Well, I'll
engagement.
check with them to see what that means. That there's some that's split it out a little bit, but they were giving me approximates. I'll try to get them to do a little bit more scope and see what that looks like. I'll look at our insurance, and I that's one thing I felt like I still needed to be able to figure out was what that policy really means, for sure.
So Carrie's wanting to say something.
Sure.
So, I voted no the last time. I still will vote no again because I am in favor of moving this organization forward, not backwards. I don't see any point in, well, there's a small point in finding out what happened. I think that there was mismanagement. The wrong person was in charge. They did not have a good team. There was no checks and balances. We are moving the organization forward and doing the right thing for Weston County Health Services, and we have solved the problem by hiring this good team. This good team is the key to moving this organization forward, and what happened in the past, they've learned from, they will learn from, they can see, and we as a board have learned that you can't hire the wrong person. And I feel like we have a good team in place. The team is making progress and moving forward. I just do not see any value in spending $100,000 to just find out what happened in the past. The bottom line is bad decisions were made in the past, and we're not going to do that again. We have the right team in place to not do that again. I hope that this board and everyone on it, we're different and we've all learned from this. So I just say move forward. I get what you're saying, Ben, about, you know, you want to be able to tell people what happened. I just want to be able to tell them that it won't happen again and that we're being good stewards of their money moving forward.
And I appreciate what you're saying. My biggest problem is that if it's just mismanagement, but what if it's not?
Right.
What if it's criminal?
Right.
What if somebody took actual money out in this community, stole it from the taxpayers, and we don't do anything about it?
Yep.
So we're gonna spend $100,000 of the taxpayers' money to find that out?
I think we should, because again, in this current political environment we're in, where we have a lot of federally ideas that we're trying to find out where money's gone and what things have happened. That's the world we're in at the moment.
I get what you're saying.
I think we have to do what we're doing in other places. That's my.
I get what you're saying,
Not-
and I just, again, have no faith in the Justice Department, and that's not our role. Our role is to move this organization forward. What the Justice Department decides to do, they decide to do. I reflect, like Mary was saying, I reflect on what was said in the last meeting, and one of the things that bothered me was Mary asked, I mean, this totally feels to me like a witch hunt. Mary asked that in the last meeting, is this a witch hunt? And you guys keep saying that, no, it's not, yet you keep saying, we want one person to go to jail. So
Mary
that's all
brought
it
up
feels
the
like.
hypothetical of jail, but I'm listening to what you're saying, and you're assuming that it's not even possible that someone stole massive amounts of money.
So
I'm
I
not
don't think,
comfortable making that assumption.
in my heart, Nathan, I don't think somebody stole massive amounts of money. I think the if you look at the trends in healthcare, this organization behaved just like every other organization during that time period. We got a giant influx of fake money from COVID, just like the entire world. We spent it terribly, and we're in a worse place than before we got the giant influx of fake money.
So, Carrie, I've heard you say on multiple occasions that in both your and Ann's tenure on the board, you've never been given the appropriate financial reports every board is due. And so it's in the absence of transparency that it becomes reasonable to say, we lost lots of money and we've never received any reports that told us what was being done with the money, which is the perfect circumstances for someone to conceal a massive theft. And so that's why, if you had been getting the proper reports the whole time, then I could more understand what you're saying. But you have complained repeatedly, you've never had the appropriate reports, and all of this money is supposedly lost. And so for that reason, that's a compounding factor that raises the risk level and doesn't put it into witch hunt territory. It makes it very reasonable to say it is a real possibility that that could have happened. We can't rule it out a priori without investigation. So I appreciate you sharing your opinion.
been waiting to talk.
Yeah, go ahead.
I wasn't here, unfortunately, participating in your last discussion, so some of this is new to me. One thing, would like to know what happened in the past so that I don't make that mistake. Okay? Is it a priority? I think looking forward at this time is a much bigger priority. What I'm worried about a forensic audit is you have to either have a beginning that you started at, a number, a solid number, or an ending solid number. You gotta have one or the other, and we have neither. So how can you figure out what happened in the middle when you don't know where the beginning was or the ending ought to be?
Well, we do have.
I just, a solid for sure number. We're still correcting numbers. We are doing a fantastic job, but I'm afraid that if you look into it, it is going to take a lot more time and a lot more cost because you have no beginning and no ending. That's what I'm worried about.
So Corinne has.
Yes.
Go ahead, Corinne.
I just wanted to say another piece of it in that, you know, I said this last time, but this isn't a witch hunt. This actually can prove people's innocence as well, or it will, you know, can potentially show that maybe it just was bad management or bad decisions or whatever. And regardless, then we've answered the questions that everybody has. Then we've looked into it, and I don't think, I mean, I could be wrong, but I don't think we need to say we're gonna commit $250,000. I think we could have Kathy ask for, you know, what's our limited start of scope 1, where are we at with that? I think we are moving forward and making good decisions, but I think there is still a lot of concern about the financial history here. And if we really truly want to be transparent about it, we should look at it.
So Ted, to your point, I do have a starting place. So I have here 2 documents from the March 2023 Financial Committee. This is from the bank accounts. It said we had $4.5 million. Here's our balance sheet that said we had $7.5 million. There is the place to start. You just give this to the forensic auditors and say, please explain why there's a $3 million difference in the amount of cash our accounting system said we had and what our bank said we had. So there's a
I will
starting
agree, but
place.
who was your audit company at that time to come up with those numbers?
Well,
Why wasn't
these
that
were
asked of
these
the
were
audit company?
these were unaudited financials.
Well, then
these
I-
were
I
prepared
agree.
by the management at that time.
I
So the
agree.
management at
So
that
you have
time,
no starting place.
we have a starting place. The management said 7.2 million in cash. The bank said 4.5 million in cash. There's your starting point.
Who are you gonna believe? You know, the bank
So-
is what
Right.
what's
So-
in the checking account.
So
but at the same time-
why is the accounting system telling a different story than the bank?
I'm not saying that we shouldn't do this. I don't think this is the right time
So
to do this.
I've already got
For bank,
this.
sure.
So Ted, I've got the starting point.
I will differ with you on that. So,
Okay.
It comes down to me that, I mean, I want to be able to tell the public, and I think the public, I don't know if you could somehow ask them, but the public wants to know. And I think the public, I want to be able to tell the public when the time is that we have done everything we can and we've closed the door on the issue. Your next board is going to start and be able to run with the great work that's being done here. And we've closed the door on the past. Let's not worry about it. It was mismanagement, whatever it was. But I can't do that. I can't look the public in the eye and say, we know where your taxpayer money went. So,
And we gave up a chance to recover.
and we gave up a chance to do it.
Potentially large sums.
one other point, and I'm not sure, and it's not the time to look into it, but we talk about the county attorney. Okay, you have to have whatever it's going to take to convince the county attorney to press charges. You may not find enough in his mind to press charges, so you've not done anything.
So Ted, this almost always goes to the FBI.
They're not prosecutors, they're investigators.
But as far as the board goes, and I'll just throw, if we have discovered something and whatever organization takes it from there decides not to prosecute, we've still solved the issue of what happened. If they don't see any way to prosecute it,
You may, that's a good point. I'm not saying that
We've
point
still
isn't
answered
good.
the question.
You gotta have enough there. It may think, okay, I'm concerned about this, but you gotta have a prosecutor. You're not hiring the prosecutor. He does work for the county, but he takes cases that he feels he can
Yes,
prosecute.
Ted, you're correct. The FBI are investigators who have perhaps some of the best forensic accountants that there are.
DCI and
right.
FBI
So
and all of
if
that.
we have enough information that's convincing to them, then they will take over for us. They will look at everything that needs to be looked at, and if they see that there's a criminal case, they'll hand it over to an assistant district attorney, some federal prosecutor, and then it's out of our hands from there.
I don't know that that's exactly how it works, but yeah.
So I think one of the things that, so we have a duty to the taxpayers. We have a duty to take care of the money that we have right now, the best that we can. In my opinion, spending $100,000 right now on this is not a good idea. And I think that we need to remember that if H&H is any, it always doubles. We ask, it always doubles, maybe triples how much time and how much money it's gonna cost. It's just inevitable that we say, okay, this is how much time it will take. At least this has been our experience on this board for the 2-3 years that we've been here. They say it's gonna take this much time, it takes 2 or 3 times more time, and that turns into 2 or 3 times more money. That's just how it is. And so, well, I mean, we do have a duty to the taxpayers. There is no doubt about it. And I think the most important duty that we have as far as this hospital goes is to keep the hospital running and to keep it going forward, doing the best service we can to this, for this community. And so we can, and maybe that is going backwards and looking to see if somebody took money from us. But so then, I mean, maybe not, but it seems to me like, so we spend all this money to figure something out maybe, and then we spend that much money trying to do the lawyer work. And so here we are, 200, I mean, who knows how much money spent on trying to figure out if somebody stole money from us. What we know is it's not there. Go ahead, Colonel.
Sorry, I have to find my audio button every
That's
time.
okay.
I just want to say that it sounds in some ways like a lot of money, but not very long ago, and I think this is probably going to come back up tonight, but we all voted to spend about $40,000 a month on IT services. $100,000 isn't that much money if we're going to spend it. I mean, I'm just saying, put this in perspective. $100,000 is a lot of money in some ways, but in some ways, it's really not that much.
No.
And I don't know, and we don't even know for sure if it would cost $100,000 to have the beginning phase looked at and see if there was enough that you needed to go forward.
There was some suggestion to look at the insurance and see what it would cover and when. That's part of it. The only thing I want to mention for reality check a little bit is that we are sitting around 42 days of cash on hand, which is not, that's about half of what I'd like to see us get to. So we do have to have those considerations as far as, because if we were to overspend too quickly, then what's going to happen is we're going to have to make bigger decisions relative to our operational pieces, which I'm not saying we won't have to do anyway, for efficiency purposes and to be able to afford our go forward, because we all know we're likely to lose money on this last 2024 year. So it's just something for you to think about. I just didn't have enough time. It took a lot of time to do this part. I didn't have enough time yet to really dig into the insurance with the insurance agent to see what it covers. I do know that was something that one of them started asking me about right away, as far as did we have insurance to cover part of the costs, expenditures relative to that. So I just want you to have those in your bucket too as you were thinking about it. Like, this is like how you go about it, your strategy wise. 42 days of cash on hand is not fun. That's what I would call it, not a fun number. We have to be very vigilant about what we do.
Is there any reason we can't maintain getting the information, not spending any money, and move this into, I mean, we're almost at the end of the first quarter. Why don't we look to project this out into a 2026 idea? Is there
So-
any reason we can't maintain getting the information, not spending any money, and move this into, I mean, we're almost at the end of the first quarter. Why don't we look to project this out into a 2026 idea, and we can vote on it later at that point?
So I'm happy to table the issue. I'd like to hear at our next meeting what you find out from the insurance
Yes.
company. The motion was to explore the idea, not to spend any money. Thank you for exploring the idea. And what you uncovered is the possibility of the insurance, which we had not been thinking about. So if we could hear more about that at our next meeting. I agree that, I'm happy to wait. There's no statute of limitations. And I think we have a lot more pressing matters, and that getting the hospital to a really healthy financial point is a prerequisite to moving any further in this direction.
I would agree with that. I think that was,
I can agree with that too.
I think that is.
So I don't think do we need any motions?
I don't think so.
Oh. Did you have your hand up, Kareem?
No,
Okay.
I agree with that. I'd be happy to table that for now and explore the insurance a little bit more.
I think that table is the wrong word.
I do too, because that infers
Right,
that there was a
there's a
motion
motion,
to table,
right.
and when you have a motion to table, you have to set a date to.
Okay. Well,
Right.
what term do you
I
would you
don't know,
prefer?
but just don't use
Defer.
table.
Maybe you guys
Yeah,
say that you
but
defer
We
it.
just decide to
Madam
take
Chair.
no action at this point.
I move this subject be put on old business on our upcoming agendas. That way it is visited,
Not visited.
and leave it on old business until a decision is made.
Right, I think that's a good idea.
And that way we can.
But I'll move forward with talking to the insurance company. Okay.
So,
And you guys see that I think everybody I've talked to is a credible company from what I can tell, so from that standpoint.
and one thing I want us all to remember in this subject is that I think we will we all want what's best for the hospital, all of us, even though we have different opinions on this. And so I think that if we can remember that the give and take is a good thing. We'll come to a better solution.
No, absolutely. Absolutely agree.
Okay.
Did Ted make a motion?
Yes, he did.
Yes, he did. So sorry,
I will
interrupted that.
second his motion.
Okay. Any more discussion? Sorry,
No, I'm just happy I'm not
My
the only
soapbox.
person who leaves motions all over the floor.
Okay, so all those in favor say aye.
Aye.
All those opposed, the same?
So I'm clear on it, we're going to have old business so that we always bring it up, basically, it
Yeah,
stays.
I don't know how we'll do that, but we'll
We'll
try to
just
keep
add
it
it.
on our
I
agenda.
think it keeps us in mind that we've got it on our agenda, whether we can get it handled this next meeting or not, or if
Okay.
it can be found, but it'll keep reappearing.
Okay, so I think Ken, are you ready for voting?
So medical staff credentialing this month, we've got Shannon Ballard, who's an ER provider, Brian Baxter, who's with Dakota Radiology, Christina Duffy, who's with Blues Neurology, Carrie Foster, who's locum ED, Dr. Reimer opted to be re-credentialed, even though he doesn't think he's going to so he's on the list as well. And then Samir Sharma, I believe is how you pronounce that, also with Blues Neurology, Baratella, stroke. Person who's
We'll get that done before.
next month you'll have less, so you'll have less to sign here. Okay, so the medical staff, we added a CEO report, so Kathy kind of discussed, she discussed here, Dr. McCarty coming. Pharmacy, Suzanne gave me a report. She wasn't able to attend, but some shortages that she's still seeing is the 0.9% normal saline with potassium 20 milliequivalent liter bags, along with Alta Place. Monument Health has gone away from Alta Place, which is a stroke medication. It's like a clot busting medication. So Monument Health is going away from that, so just maybe just doing TNKs, which is an alternative medication for that. We do utilize cocaine 4% topical solution located in the Omnicell. It's expiring for anybody that comes in with a pretty severe nosebleed. And vasoconstriction helps with that. We are going to discuss maybe not using that. I don't think the providers would use that anymore. They have a different medication that they use. So we'll talk about that next week at the meeting again. Keisha sent out a radiology menu to all of the providers, basically with just all of the services that we can provide in radiology. She talked to the providers about orders for kidney stones, ultrasound versus CT. Ultrasound, you might not be able to see a kidney stone as well, so ordering a CT scan. Phillips is going to be in-house on April 28th to the 29th to talk about the new CT scanner. So she's hoping to hold the town hall for that. Jim's new chem analyzer, I believe it was delivered today.
Today, yeah.
So good news for lab. He's got a potential go live date around the second part of May. At the time, he was discussing high sensitivity troponin testing to be run on it, but it was still sitting with the FDA, so more to come on that. Home health, didn't really have any new updates for home health. Acute care, Denalda had 3 swing bed patients. She was getting a lot of referrals from Gillette because of legacy being on their admission hold. And then we did discuss an emergency preparedness policy on severe frostbite, so there's going to be more to come on that, treating it here and then transferring them to a burn unit. And that's about it for medical staff. For quality, I actually have some information.
Do we have a severe, do we have people coming in with severe frostbite?
We don't, but it's better to be prepared than not prepared.
As part of our trauma program. And you really need to get the medication so that their blood thins out and they have receive plans.
I just was curious on
Yeah.
people coming in.
Actually have that for you guys this month, so.
Wow. Fancy colored graphs. I love it. It's a challenge, thank you.
We're all stepping up our game.
So this will be a little bit thicker in the coming months as we work with the managers on getting the data collected. You guys had kind of talked about Suzanne's savings. It's on the back, her little nifty graph that she made with her $70,000 savings. So the first page is the accounts receivable days. Sandy actually would like to change her benchmark. You can see our corporate benchmark right now is at 52. She'd like to drop that down to 47 days. And then I'm also going to work with her about how she can enter in each different department's AR, you know, like the clinic and home health, so that we can kind of show those out too. And then the next couple of pages are ED times. Our ED admission to departure time has been really good. It was about 88 this last month. And then also our arrival to discharge time is we are below our benchmark, so we're going to drop that benchmark down even further. Right now it's at about 120 and 125, so we're going to drop it down to 115 and push that limit a little bit. On the next page where we're struggling a little bit still is the ED arrival to ED transfer time. We're working with EMS. We had a meeting with them today to figure out how they can better serve our community and get our patients out. And then we also signed a new agreement with Black Hills Lifelight, so for provider agreement. So hopefully we can get our patients out and see this number come down even more.
How did that meeting go with the EMS?
Okay, it went okay. I think that And they're talking about trying to solve a problem, but it's going slow. I'm very concerned about, and we talked to them about the examples where people are having to go by private vehicle when they're really sick. And that's a real liability for all of it, for everyone concerned, the person that's sick and our facility, that sort of thing. So that's why we did get that preferred provider agreement, preferred piece, because they will take our patients that are even non-emergent and fly them to wherever they need to go to try to get people where we need them to be. So emergent or non-emergent, either one. I think that's our workaround, basically.
And there was a similar price as the.
Yeah, when they did a comparison, they showed me some data, and the comparisons is with the mileage that we have to get places and stuff, it's really just as comparable of a spend as it is by going by ambulance on the ground. So, and that we talked a little bit about insurances and how they pay really pretty well on that. And actually, they even said that people having those insurance programs, really, that's just beefing up the money that the ambulance services have on hand, if they sell those programs, because that's really not needed, because usually your insurance pretty well takes care of it, most insurance pieces. So
Now, what did we sign with for air ambulance?
we signed with it's Air Methods, and they have it Black Hills, and it's with Wyoming Medical. Wyoming Medical and Black Hills both is under the same Air Methods group.
Is it the one that's based out of Gillette?
They're based out of Rapid and Casper.
Oh, okay.
Yeah, so. But I think that'll work pretty good.
I work for a company that's owned by the Trustees, and they've got a lot of employees in this area between the ranches and Bridger Pipeline, and it's quite a big company in Wyoming. There's 2 air ambulances in Wyoming. One, they are self-insured, but Blue Cross Blue Shield administrates our insurance policies. One air ambulance is going to be $75,000 to get us almost anywhere. The other air ambulance is going to be covered by our insurance. And I don't know which one.
The one that I was talking to, the average price for these flights was around $7,000 unless you're super critically ill type of thing. And so that's actually comparable to what an ambulance is running for people.
I agree. I've never heard a price that low for an air ambulance.
Yeah.
I've never heard anybody talk downtown of getting an air ambulance for under $70,000 anywhere.
I think that's changing.
It may be.
I think
that's where people are going.
Well, and they don't get paid that. So to have that price tag doesn't make it work for them, because they're not gonna get paid that anyway.
Well, if they can collect it from an insurance company, they're going to charge that much. My thought is, okay, what we need to do is sign with an air ambulance that some of the local insurance, or people that are insured, is going to pay for. You know, and I've always disagreed with the company, and I brought it up millions of times with HR and our insurance. Okay, I'm laying out there in the ditch, half dead. I'm supposed to tell them what ambulance to call and what not to call?
I'm gonna take the one that passes by.
Well, I want the cheap one, because that's the insurance company. You know, if you're calling an air ambulance, you know, can you afford this? Can you afford a $70,000 bill over your other bills that you're going to receive, time off work? You know, I don't understand why they would insure that way or have an agreement. And I think it's an agreement with the air ambulance that we will use you if we can get a discount price for our employees.
Well,
Because they got like 2,500 employees.
yeah, I'm pretty sure they could get that kind of deal if they worked at it, so. In fact, I may see if we can work something out for ours too, but I just wanted to find a solution for people to not be sitting in our ER when they need to be someplace else. Or in a private vehicle. That one really bothers me. So, really bothers me.
An oxygen tank right here.
Got
Elk were running across the highway.
Is this the hospital billing and the professional billing, or just the hospital?
I need to have it closer, I can't.
Oh,
Yeah, or you get it in a minute. Okay, turn your car.
Just take your glasses off and have them hold it across the table.
Because we discussed combining hospital billing and patient billing. to
That's
monitor
not the
PRVs.
combined one, that's
So this
the-
is hospital bill, okay.
Yeah.
And the second question is, I saw in the newspaper that it looks like the county commissioners are looking at the possibility of creating a hospital or an ambulance district that would get 4 mills.
Right.
No, up to 2 automatically, and then the other 2 would have to be voted on.
Right.
Additional, much like they did the hospital.
Right. So-
And it is just they're not deciding to do that. People have asked for that. So they're asking the people what they think, so they make a decision. And that would be run much like a board, like this board, or a 5-member board
3 or 5.
from the public. And, there's also an option, Upton may choose not to, the city of Upton may not choose to go with this, would they be excluded from the district. But also at the same time, I look at it, okay, there's always an opportunity that member board may decide. There's been one county in Wyoming that supplemented air ambulance insurance for everybody in that county. So that if you needed an air ambulance, they actually bought a policy. That county bought a policy for the citizens of that county in case they needed it.
Right, so my question was, I think, was it March 30th or 31st?
31st will be at the event center.
Uh-huh.
And I believe, I don't know this for sure, don't remember, but I believe they are having another meeting for Upton and one for Newcastle, and then one for Weston County. And of course, anybody can go to any of them, but the one on the 31st is kind of the broader scope for everybody.
So my question is, would that, if that passed, if people wanted to pass that, would that at all help our problem? Have we thought through those things?
I thought through it. They have trouble getting EMS people, so there's one of my challenges right now that I see is whether or not they're gonna find the workers to do it. So, because that's the problem now, or at least part of the problem. So, it depends on how that program could be brought forward and how they entice people into that kind of program. So, no, I'm not comfortable with
I
that
see,
not.
yeah, I don't know if that did pass, and of course going to, let's say, a 5-person board that would run that. I think that would be their decision, that 5-member board, of whether, I don't know that on 2 mills you could provide an ambulance service, but you could supplement maybe an ambulance service so that they had more ambulances in town. Or possibly buy air insurance for, I don't know what I have no idea what they would decide to do.
I can almost think that they might come to the hospital and say, hey, we'll give you this amount of money for you to run this ambulance service. I'm just telling you what I think might happen. And then it's a matter of really knuckling in and figuring out if we can afford to do that for that kind of, and can do it.
Because all the analysis heretofore have not considered that as a possibility for funding. And so if it was 4 mills, then it could change. So I'm not saying we should, I'm just wanting to make sure everybody is aware and that we're,
go to the meeting.
and we're just thinking about that as something that's out there.
Oh, I definitely was thinking about it. I thought, well, and I know that Gillette's been talking to him about it too, asking them for more support because they aren't getting the support that they need to be able to run the services the way that they're needed in the community.
So we have a hard time getting people out in a timely fashion.
Yep.
Is what we're saying.
Yep.
But the problem is a lack of staff. And if you add an ambulance district and a mill levy and all of that, you're not going to solve the problem of we just don't have the people to do it or the people that want to do it. So
And what's the impact on property tax?
that's what your property taxes
2
will
mills.
go up and you won't.
2 mills, and then
I'm
it would
not sure
go
we'll
on the
solve the
ballot
problem.
for the voters to vote an additional 2 mills.
If they wanted to, or
Yes.
in 2 years? they could vote to dissolve the district too.
The new store. This is the one-stop shop. We have a pharmacy. We have a bootlegger's liquor. The deli, the food that you can get at a lunchtime is so amazing. The coffee shop. Certain Friday mornings, there's 30 people sitting here in all these chairs. This is the hub for people to come and visit, have their coffee, have their donuts. It's amazing what this area has done. Totally amazing.
In 2 years, they could vote to dissolve the district too.
Well, so I'll just let everybody know that I have in the past, a year ago, had conversations with Roger Hesping, who was a former member of this board and ran the ambulance service for a long time. And he was the first person to bring that to my attention as a possibility. And I think it's been more than a year ago, but in his opinion, having a hospital or ambulance district with 2 or 4 mills really would make it a very doable situation. I remember that was the kind of the bottom line. I can't remember all of the details, but I think he certainly knows what he's talking about.
I just can't see how 2 or 4 mills would pay for that.
Well, it wouldn't pay entirely, but what he was
don't see
saying is
how
that would
an
make
increase-
enough difference
Yeah.
to really make it work out. So,
Right,
okay.
but I also don't see how an increase of 2 or 4 mills in my property taxes would make the ambulance get to my house any faster to save my life. I think I'll still be dead.
Yeah.
There's no people to run the ambulance, and logistically in Wyoming, they can't get to us fast enough. They just can't. You would have to have an ambulance on every corner. How are they gonna get to Ames?
It took 2 hours.
Yeah.
Well, the problem.
It's not gonna happen,
Right.
so
Right, you're talking about EMS. I'm talking about the problem that we're talking about is when people come to this hospital and they're sick and they need help and they need to get somewhere, we can't make that happen for them.
But
So that's
Kathy
more
is-
the way I'm looking at it.
Kathy has just told you a way that she's working to make that happen without any cost to, any additional cost to the taxpayers. So
Right.
that's a creative and good solution that sounds like it will be more effective in solving the problem than.
I'm not advocating one way or another.
I'm just-
What-
yeah,
What people
I'm
should
just
decide. I
devil's
just wanted
advocate.
to ask if
I think,
everyone
yeah,
was
being
aware of
informed
it.
and making their own decision, you know.
And,
that's-
and I was really
that's-
just wanting to know what people's opinions were on
I
the
just,
topic.
I know I've heard people say they not had an ambulance, no way to get an ambulance. That, you know, what can we do to help? So we got ambulance, okay? So I think the commissioners have heard it for 10 years, probably more. So let's bring this issue to people and see what they want to do. Is, so we can have a discussion, yay or nay.
I'll bet you money they come to talk to us about it. That's what they.
Well, right, that's why I was bringing it up.
Yeah.
So are we good to go, are we good to go to JT and the HR?
I don't know, we finished your report.
Kim here.
Kim, I will apologize.
Page 3.
I was part of it. I will apologize.
Sorry.
I'll just make it really quick. And then satisfaction survey return rate, that's the clinic return rate. So once we get more return rates, we can kind of drill down on the surveys and figure out what else we can work on to improve patient satisfaction at the clinic. This one here is Heather's calls. I'm gonna work with her to have her drill it down into bi-monthly, just so that it's a little bit easier to digest. And then the last page is Suzanne's, and then just that one right there.
This one.
Yep. And then the only other thing is really the manner. We've just kind of gone back to the basics with coffee. I did a root cause analysis presentation to the department heads today, so hopefully digging deeper into what the source of the problem is. So more to come on that as we grow together. All right, I'm done.
Sorry, you're up in the middle.
I apologize for,
How many pages do you have, Jane?
Okay, JT. You're
gonna go really quickly. Number one, I'm happy to report we do have finally a position control that has an actual FTE allotment for every department and for the whole hospital that we didn't have before. With that, we, probably the next board meeting next month, I'll have turnover rates and be able to provide those ongoing. It was just getting that original data kind of a little difficult. Shane and I are working on some strategies for our CNA shortages so that we can work towards getting agency out of the building. And I'll have more information about that probably in your next board presentation. I did have, Kathy and I met with Pronghorn today. Those are kind of our brokers for our retirement. The good thing is that next month I will have a report for each of you for where our funds are and how they are faring as far as the market's concerned. I have had more conversations with Gallagher with our healthcare options. I'm noticing a difficulty with our Blue Cross Blue Shield, and so I'm going to kind of do a little bit more investigation where we're seeing our numbers increase. I think there's a problem with the way the program was built with the Weston County Health Services portion. I'm finding that our employees are paying more deductible and more out of pocket for Weston County services than they're supposed to be, which means that we're paying more and Blue Cross is paying less. So I think that we're going to find out more about that, and I'll have more of that for you for the next board meeting. And I'm going to just leave it at that.
Any questions for JT? Okay, you're up now, Shane.
Okay, current census is 45 for February. We averaged 43. We had 6 admissions in February and no discharges. So currently have 6 referrals with 2 of them that will be admitting next week. So continue to see good movement there. Staffing, we actually started a new staffing model this month with nurses to cover the increase in staffing, so that seems to be working. I haven't really heard any complaints yet. And like JT said, the next part we'll be discussing the CNA part with it, so be looking forward to that. And then I spoke last time a little bit about Medicaid pending. We were 8 last month, we're down to 6. One of them has been submitted. I feel good about it. We're just waiting on the state. Another one got submitted today with everything, so I think that one's looking good. So we just got 4 left and we're seeing movement on them. So that's mine.
Very good.
And residents of the manor, we've got self-pay, and we've got Medicaid.
Medicaid and then VAs.
Yes, the VAs, I'll talk about self-pay and Medicaid. How do we know that new residents actually, how do we pursue knowing whether they actually have cash to pay?
So that's
or does Medicaid pursue
so
that?
That's one of the things we're doing a little differently to help with these Medicaid pending ones. So the last couple ones, we're meeting with the families beforehand, and if they're saying they don't have money, we're okay, you're going to do the Medicaid application with us, and then they show us all the paperwork, and then we have a lot better guess. So that's
Okay, do they sign an affidavit that what they're saying is true?
They have to when they do the Medicaid application with the state.
Right.
So.
You know, I'm not questioning anybody, I'm not pointing fingers, it's just that there's a lot of,
Yep.
it's a lot easier to pay $6,000 rather than $10,000.
Yeah, yeah. So we've inserted ourselves in the middle of that.
Okay, I
so-
appreciate that. I appreciate that. Or let the state pay $6,000 rather than you pay $10,000.
Okay, so now we are on to bylaws. We want to decide as a board how much time to give into this.
I'm happy with 5 minutes total for everything that I want to say. If you give me 5 minutes, I'll be happy.
Might need 5 minutes too.
5 minutes going once?
Madam Chair, looking at the time of the night and knowing that we have an executive session, I would suggest, could we limit to maybe 9 o'clock, 40 minutes, if it's needed that much? I don't know that.
I did mine in 2.
Okay.
The last time, I can do it again.
Well, we're not making a decision tonight. I would agree with that, but I would like to hear reasons that's, discussion on pros and cons.
Okay, I'm just trying to think.
Do you need the bylaws pulled up?
Oh, do we all have copies of the bylaws? I think before.
You didn't? I will loan you a copy.
Before we start, I think Allison, you should kind of talk to us briefly about what you talked to me about in our Monday meeting. Can you do that? And also maybe this stuff that you sent us.
Okay, so, what, I just wanted to make sure that you all understood, what I had described to you, which is the Administrative Procedures Act in Wyoming, does not have a requirement that new rules, which would include bylaws or policies, be read more than once at a public meeting, but it does require that, at least once, and that public comment be permitted. And so my recommendation is that you, have it be read, any changes that you're considering adopting that go through at least 2 readings, so that the public has an opportunity to participate if they'd like to. And then additionally, there's a odd statute in the hospital district that I sent to you all that requires that the rules be recorded with the county clerk, and so we have taken that to mean that that's the bylaws. And so my recommendation to you is that whatever changes we're considering, that we put them together and have them approved all at once, if possible, or in maybe a couple of chunks, because technically the public needs to be put on notice of those changes by filing them with the county clerk. So.
Thank you.
Sure.
So, and then, so I think that, we'll go ahead and work on this, and I'm not sure I think 9 o'clock is too long.
Okay.
And it's a good place, it's good to have a number out, and,
You guys can go.
and, thank you guys for coming, appreciate it.
Are we dismissed?
If you want to, you're welcome to go. If you want to sit here
Okay,
and
so I just
listen
had
to us
one
talk
more,
about
but you can go
bylaws.
too. I'm going to. Okay.
Did you look at me so I go through?
No.
Oh.
I will.
If I have to be here, you can.
Well, I think the last people that are here, the last 4 or 5 is going to be.
Thank you, Tish.
Thank you. Have a nice evening.
Yeah. And so anyway, we need to be thinking, anyway, so let's figure out how this goes, see how we do, and we'll figure out if we want to keep doing this at the board meetings. Did you have your hand up, Karen?
Sort of. I just have a comment. I'd just like to repeat the comments that I made the last time, that I do not do well with things that are presented to me right at that minute and ask me to make a decision on them. If everybody who has changes, if we could present them and then have at least a month to think about them and then vote on them, I would greatly appreciate that, because I'm a analytical person and I like to think things through, and I just don't want to have to vote on something as important as a bylaw change without having at least some time to think it through. That's just a request I'm making of my own self.
I think that you guys might want to think about your process though, because like Allison had mentioned.
I like what Allison, because
Okay.
that gives me at least 2 months to think things through, so.
Okay.
We aren't gonna vote on anything tonight.
Okay.
Is that, everybody in agreement with that?
Thank
I
you.
will echo that. If it takes 4 months to get through this, I want to look at it as a complete document, because changing one portion changes another portion possibly. So I want to, let everybody, in my opinion, make the suggestions they would like to see changes, make notes however you want to, but then let's revisit this, and then we'll go on to another section another time. But let's revisit this when we do decide as a complete document, submit it to the county clerk and the state at one time.
So Ted, I believe you were absent from our most recent meeting. And what I had proposed there is not duplicating efforts. So my presentation is just talking about ideas. What do we want the chair to be able to do in terms of like committees? Who should form it? And if we can agree on the ideas, then we can just ask Allison to propose whatever changes she thinks would be necessary throughout the bylaws and make that her responsibility rather than ours. She's our attorney. She probably helped write the bylaws. She probably knows them better than us. So if we can just agree on the ideas, then we can just tell Allison, here's what we'd like to see happen. Could you please propose those changes to us in all of their appropriate places?
I think Allison.
Just to be clear, these bylaws existed before me.
Oh, okay.
And we could restructure them completely if you'd like to. I have no ownership of them.
So I'm confused. So my copy of the bylaws are dated in, I think, 2023.
Those were amendments made by the board at that time. And I did assist them in making their amendments.
Oh, okay, I got you. Okay, thank you for clarifying.
Just like you're wanting now.
I got you. Thank you for clarifying.
Okay.
What if we went around the room and just listed off as quickly as we can the changes we have to Article 1 and 2? Isn't that what we were concentrating on?
I think you concentrated on Article 1 and 2 through 4, something like that.
Yeah.
Through 4. Yeah.
Article 1 and 2, and then through,
Section 4.
not Section 4, I didn't think. What did the minutes say?
I thought it was through,
And I may be incorrect if they can.
I thought we said page 4 because that's the end of Article 2.
Yeah, it is. Page 4, Article 3 starts the middle
I
page.
don't know if that's what the minutes said.
I marked it on my bylaws, and we were stopping on page 2 after section 4. I wrote it specifically on my bylaws.
Oh, too much shorter, okay.
Okay, that's what I remember as being in the minutes, or.
Article 1 and 2, section 1 through 4.
Okay, gotcha. Yeah, I misread that. No overachieved going further.
That's all right.
You got next week's work done.
Yes.
Okay, so where do we want to start? Do we want to start with Mary? Do we want to start with Kareem? Do we want to start with Carrie?
I would like to start with Carrie because I have some of her notes. And I've got some of Nathan's notes, but I have nothing marked on 1 through 4 or in that area from before. Now, maybe I'm missing your notes from before. I don't know.
I don't have your notes.
Oh,
I don't have this one.
I don't know why you have it. I sent them to Tony because he asked for that was in September.
Yeah,
Well,
I
and
never
you guys
got any
remember
from-
when you started this, you were gonna work with Tony, and he was gonna kinda help you guys through it, and you were.
He was supposed to coordinate them all. and-
Try to
Well,
work
he
with
still
everybody's
would-
changes.
He's still willing to do that, but if you guys do it in this process, it won't work out
Yeah.
for them. So.
That's fine. All right, I guess we'll go. Me? So the only change I had was in section 2. I proposed that we add the words, "The term shall commence on the day after the election of an elected trustee." Because what we found after the last election is we had the chair, all of the officers, the chair, the secretary, and the treasurer were all not reelected, and so there was a void of who was really the board for about 2 weeks between the date of the election and the date of the first meeting. All of the officers, the chair, the secretary, and the treasurer were all not reelected, and so there was a void of who was really the board for about 2 weeks between the date of the election and the date of the first meeting when the new board was installed. So there was a void of about 2 weeks where it was kind of unclear who the board was. So all I'm proposing is to add to the bylaws that the day after the election is certified, that you know exactly who the new board is.
Well, they only have 10 days to come in and get sworn in.
Right, but.
So they
you know,
can do that right away. Is
Yeah.
that what you're saying?
No.
No.
So I'm making it, because then it was kind of unclear who the board was. By adding that sentence to our bylaws, it makes it very clear who the board is at all times, and there's no void in between where there's a question of who the board might be. So
Will you say that sentence again?
And Carrie, I would just want to make sure there was some reference to, that they can take no action until they have taken their oath.
Right.
Just because otherwise I could see somebody jumping in without taking their oath.
yeah, that's perfectly fine, Allison. I respect Nathan's point, and he's right in that if we just throw out our idea of what we wanted to accomplish, if the board agrees with it, then maybe you could help us with the perfect language to solve that problem.
Sure, I just wanted to make sure you were aware that that's one concern I had.
So can you translate your specific change into more like the idea?
The idea is to make sure that there is no void between the old board and the new board, and there is a hard cutoff between the old board and new board, and that everybody knows exactly to the minute who your board members are. So it makes it easy for your CEO to know who she is.
And it wouldn't, and honestly, for what you're trying to do, it would not have to be the day after the election.
It
just
could be
has to
whatever.
be.
Yeah.
And I agree, it was confusing, especially where we had lost 4 people and gained 4 people. It just was it was so.
But you still have to
But you
swear in
didn't.
and sign the
Right, but
Yes,
at
and
that, at that first meeting, you didn't know who was the chair and who was supposed to open the meeting. It was kind of
Right.
unclear.
Yeah.
So.
And we also don't know who, oh, I lost my thought. It's not final until we have the
canvassing board.
The canvassing board,
Yeah.
thank you for that word.
Till after
Yes.
the canvassing board certifies the
Yeah.
election. Yeah.
So Carrie,
Yep, that's fine.
what I'm putting down in my notes is you would like to have a more clear cutoff for the transition.
Right,
That's
I
just
think
in my notes.
A cutoff, yeah, change
Clear.
more and make A.
Right, so that's just the idea I've got in my notes. Okay, that's good. Okay, yeah.
Yep, that was my only issue I was trying to solve.
I had gone beyond.
Let's just go around,
Okay.
if that's okay. So,
Yeah.
can we do that just to keep us?
Sure. Oh, right. Yeah, okay.
So Nathan will be next.
Sure.
Thank you, I'm sorry.
Yeah, no, I wasn't.
So, I think just honing in on section 3 of Article 2. And so the idea is the community elects 7 people and they give their decision-making authority to the 7 people. So how much of the community's decision-making authority should be given to one of the board members to use as they would like? That's the idea. So where I think perhaps too much decision-making authority of the community is put in their hands is on the topic of committees. And so I think it reads, the chair will appoint committees, the chairpersons of the committees, as authorized by the board. I would like to see that be a process where the whole board is making that decision somehow. And then also the removal of people from committees. I don't think that should be in the hands of one of the board members. So I think if we're going to form a committee, that should be a board decision. Deciding who's on the committee should be a board decision. And deciding if someone's removed from a committee also should be a board decision. And so that's the one idea about committees. The second idea, and I'm bringing this up because of a lot of comments from different community members, is we have the liaison concept, which I find the word liaison to be somewhat confusing. I don't use that word, so I'm not sure what it means, but it says the president shall be the board's liaison with the administrator. The president shall be the board's liaison with the legal counsel. So my input is, I think the board has its own voice in an open meeting setting. And if anyone wants to know what the board thinks or wants to decide on, I think the open meetings law require that to be brought to the board as a group. And so I don't really think we have a need for the liaison. That's that idea. And then I don't think I brought the wrong computer, sorry. I don't think it's in this section, but if it is, I think we should have something where each individual board member could add something, maybe like one thing to the agenda or something like that, if they felt like they needed to. I know we have sort of a process, but just making it more clear that,
I just kind of was gonna tell you what a liaison is. It's a person that's a go-between or intermediary facilitating communication, interaction, and cooperation between different parties.
But here we all are. There's Allison,
right,
and there you are. And so we all know each other.
Mm-hmm.
And so I just think the whole liaison concept is rife with the potential, I'm not saying it's being abused now, but it's rife with the potential for abuse in the future. I'm told it has been abused in the past, and so I don't understand why the board needs a go-between between us and our administrator and us and our attorney when we all meet on a regular basis anyway. And also in our open meetings training, and Ann cut me off if I run out of time, but it says alone you're just a person. So I just think the liaison concept goes too far of giving too much of the community's authority into the hands of one person, where it should be with the whole group. So that's all the ideas I
So let's just keep going around. Okay, so go ahead.
So I'm gonna kind of, I don't know, add to, maybe change up a little bit what, my opinion on what Nathan just said. I think, while I understand and think it's necessary that there's got to be at least a notification process of the chair, to the chair, if a member does need to go directly to leadership. So there's got to be some control. I don't know if liaison's the right word, but I would propose that we add something in there that says the chair's position is such that, okay, let's just say liaison, it's the best word that we've got at this point. But the opportunity is there for other members to have discussions with leadership, but it has to be at least told to the chair that it's going on. Because I do think the chair, there's got to be one point that at least has some type of control of what's going on. So in other words, the other side of the coin would be 8 or 7 people all going to Kathy and telling different things, and then that would just lead to more problems. So some type of control related to that. I don't know if that's the correct wording, but.
Can I ask you a clarifying question?
Sure.
I could definitely support that idea if it's for the purpose of preventing Kathy the frustration of having 7 different people asking her to do things that take her time. I agree, we should avoid that situation. But if an individual board member has just a question, hey, I heard this, what's happening? Are you still thinking of that as included in this idea?
I would think that it's a little bit subjective. I don't know, a simple question being asked, I don't think is necessarily what I'm thinking about. I'm thinking about asking for something
work or information.
Yeah, something to be accomplished or something that's going to change workflows or, amount of time, that kind of idea.
I can agree with that idea. I think that's a good idea.
Just to add to your idea, our attorney is paid by the hour.
Yeah.
So if you have 7 people, all with the ability to call her, that is really not a good idea at all. So I can totally see where the chair's role to coordinate the asks of our attorney. We shouldn't be going individually, all 7 of us, to our attorney with an ask. It should go through someone, I think.
Yeah, I don't know if the right term's liaison, but something, controller of the, no, it's not, something along that line.
I get what you're saying though, because otherwise Kathy has 7 individual bosses and she doesn't know where to go, and that's a symbol for disaster.
That's not a good situation.
Right, we've all come to honor that, the next board might not.
Yeah, exactly.
Right.
Yeah.
Okay. Well, so can you put that into words? I'm trying to get the idea into words.
The chair should be able to have a level of understanding and control of what is flowing to hospital leadership.
Right. So what we want to do is prevent Kathy from being asked to do work by 7 different people and being pulled in 7 different directions.
And the chairs only makes sense that the chair is the person that would be.
Okay.
That would be that person.
Okay, I got you.
Just a silly question. As I think about the board as a whole, where does that take that? So if you guys, because we had that discussion at one time, I'm just asking, do you have to have the board as a whole if you're asking for work to be done to be voting on that, or is it okay that you individually ask for things? That's what you were. I was going to say.
That's what we need to decide.
Yeah, just decide that.
I think that we should be able to ask, but I agree with Ben that the chair, we should have a duty to keep our chair informed.
Yeah.
So.
And I don't have any problem with people asking me questions. It's if I start getting a whole bunch of assignments that it would be.
Agreed.
Right. That would be the problem.
Right.
So then, I mean, if everything went to the chair and the chair knew what was going on, then when she started to feel like you had too many tasks, then she could come to the board and say, hey, listen, this asked for that, this person asked for this person, because we should all know what. So this person asked for this and Kathy has 12 things that she asked for. I think we as a board need to talk about how much work we're giving our CEO. So, and if the board doesn't know what's going on.
So given the training we just had on the open meetings law, I really think the proper lawful mechanism is to perhaps alter your idea some, is to say, don't ask Kathy to do any work. If you would like Kathy to do some work, add it to the agenda, present it to the board, and let the board decide rather than one person of the board deciding. And so that's kind of the idea, is if you would like to ask Kathy to do some work, should it be a board decision, or should it be just the decision of one person?
I would think most of the time it should be a board decision, but I would think there would be exceptions to the rule. You know, so there's got to be a mechanism to do it, but most of the time, especially based on what we were just found out about, you know, the public requirement.
So, I have a question.
Yeah.
Does everybody feel like they don't get what they want?
Not at all.
I mean, 'cause we have every meeting, there's the chance for you to add to the agenda.
Right.
So why do we have to change that?
I'm mainly thinking about not this group. I'm thinking about a future group, like, and I've heard the same stories about previous boards got in trouble if they tried to say anything to the leadership outside of the chair. So that's one side of it. The other side would be an absolute runaway group, everybody going to. So I'm just looking at it from the standpoint of trying to answer.
That's what happened to me with a previous board. I made a request of the finance department for financial information, and then it was brought to the board and they had to deem my request worthy of, and that's not appropriate either.
Right.
We as each board member have the right to make requests.
Right.
So there has to be a happy medium. I get what you're saying totally, but I think there has to be a medium, and I think your chair, that's why you have a chair. Your chair has to have some, if you take away all their responsibilities, you end up with a CEO in an unworkable environment. I mean, Kathy can't function with 7 bosses.
And I think we're mainly talking
talking
about it as to stop any future issue that goes beyond this group here. You know, I definitely don't feel like I'm.
No, but I would bristle at a board, you know, having anybody's request to have to go to the board, and then the board deems you worthy of your request. If you want the information, you should have it, but there also has to be a medium between 7 board members dumping, 6,000 projects on Kathy's desk, and Kathy can't do anything except manage the board. So there has to be a medium.
Right, and that's why if it was a email, a phone call to Ann saying, hey, I'm gonna ask for this.
Right.
Okay, but if she gets 20 phone calls all asking, she can then say, oh, wait, she's overwhelmed.
Right. Say maybe the board needs to have a discussion about how many requests we're making.
Or at least prioritize them.
Yeah, but I think the chair has to have a role.
I do too. Some level. I don't know if liaison's the right word, again, I don't know.
Yeah.
But.
Yeah. So my final thought is, I think we have agreement on the concept. It's just the mechanism. What's the protective mechanism so that all these people aren't saying do this.
And you don't have a runaway chair.
Right,
who
but
says
also we need to do
it.
all of our business out in the open and open meetings also. And so because of the open meetings law, I'm favoring the mechanism being, if you'd like to task management with a project or request for information, let's do it in part of an open meeting so that the public knows what's happening and what's being asked for.
First of all, starting a statement, I think we have an agreement. You haven't talked to everybody yet.
Yeah, we don't have agreement yet.
I think there's a little difference in opinions. First of all, I understand what Carrie's going in. My notes say sworn in. Okay, that trustee is not a trustee until they're sworn in. Now, if they can't get to the courthouse or get to whoever swore them in for a couple days, they're not a trustee. Also, in the next sentence, I wrote in, serves the remainder of term after they're sworn in. The term of an office of an appointed trustee begins on the day appointee accepts the appointment. No, it doesn't until after he's sworn in. I think that sworn in needs to be in there twice.
The appointee accepts the appointment and is sworn in.
After he's sworn in. Yes. I also have a little note in there to see Article 3, Section 1, which we're not discussing tonight, but later on, the person can look at that, because there may be a conflict there. I believe what you want to do or looking at, and I'll start with in the middle of the second paragraph on page 3, the president of the board shall preside on all meetings, and on down to several sentences. I don't believe that refers to anything in a meeting. No. That refers to out of the meeting. If I got a question that I would like her to bring up to her so that she can bring up to Kathy or maybe another board member, because I cannot conduct business by contacting 3 other board members. She can't either, but she can bring it up to Kathy. She can bring it up to a couple other board members where there's never a quorum. And what do you think about this? Should we put it on the agenda? And also, I will agree with you. Kathy doesn't have the time to make 7 different phone calls. Kathy, our legal advice.
We're paying her to do.
Yes.
We don't want to pay her.
We've got
make the
one
7 phone
contact,
calls.
and that contact can distribute that information. That's what that refers to us, out of a meeting, not in a meeting. Because we all have the opportunity in the meeting to address Kathy. Contact, and that contact can distribute that information. That's what that refers to us, out of a meeting, not in a meeting. Because we all have the opportunity in the meeting to address Kathy and to address, and I don't want to write bylaws. We have the opportunity later on, you'll see in the bylaws, to change bylaws. Any board, as long as we leave that in there for the next board, I don't think we should change what if the board gets too controlling of its members. Let them make that decision. We can't be too detailed in what we do
Yeah, that's a very good point.
to a future board. Let them make the decision of what's too controlling and what they would not want.
I agree with you, Ted, but Nathan's point about the chair having the power to appoint the chairs of committees or committee members, that also gives the chair the ability to take somebody. That happened to me too. The chair, not the board, made the decision to remove me from the finance committee.
Okay, but
I don't think that should have been the chair's decision. I think it should have been the board's decision. So
I will agree, but you
I
can
agree
change
with
that one sentence
Sure,
by saying
absolutely.
by the majority of the board.
Right.
It is brought before
Agreed.
that decision or
Yeah.
that idea,
I
the chair
agree.
needs to bring that before the board, and the majority of the board makes that decision. You know, in
You
in
just
that
take the
instance.
power to appoint away from the chair and give it to the board.
Yeah.
Well, you know,
Or to-
I don't
or
know.
To me, it would be the best way to do that is to go ahead and give the chair the ability to appoint people.
And be
the
ratified by the
committees.
board.
The board votes on it, and then once the board votes on it, then it's the board that has to change it.
That could be too.
I think
That I
that's
ratified, you know,
Yeah,
it's like
that's
when we
fine,
first
too.
started, we were all brand new, and could happen again. That the chair, the bylaws gave the chair the opportunity to appoint. She did it in an open meeting with all of us there, asking what committees you would like to be on. She appointed, and then it needs to be, I believe, ratified by the board.
And
then-
only the board.
And
then
at
the
that board.
Once
Agreed.
the board has voted on it, then it shouldn't be the chair's job to change it.
Yeah, I
Yes.
agree. I agree
The
there.
chair can make that suggestion that, well, okay, Ted has missed one meeting, he needs to be moved up to the finance committee. So, she can bring that before the board.
Right.
And if the board agrees, Ted's no longer on the finance committee.
Doesn't that sound awful?
Well, you know,
No, that's fine.
you know, I'm
Yeah.
trying to use a
Right.
demonstration
Yeah.
there. Also in section 3, I've got another note. Look at Article 3, Section 1, so that there's not a conflict. So, and we're not dealing in Article 3, Section 1.
You're right. Yep.
So if you just write maybe yourself a note to read Article 3, Section 1 and see what I thought pertained, or what may need, if you change this, you gotta change that.
Yeah.
Okay, I'm done.
Okay.
Mary, you've got
Yeah.
7 minutes.
Oh my goodness.
I don't even have that one.
Oh, we got
Ann
and Karina.
And Karina.
Oh,
So
I'm
you
sorry.
need to take,
No,
you need to take your
the
time.
only thing that is a concern to me is the gap between when people are elected and when people are actually on the board. Another one is, but it's down the line, was, we need to have an in-place orientation, an official orientation for new board members. Because when we came on this board, we were just kind of thrown in, and really, nobody told us what we needed to do. And I think, to be fair to people coming on the board, they need to have an orientation.
Yeah, and if you
But I
have it
do
in the
think
bylaws
that-
fairly quickly.
Yeah, and I think, what Terry said at the beginning about being sworn in, I mean, when they're sworn in, then they're on the board.
So there's a clear, because it was very question, we just didn't know.
Yeah.
What, it was not clear.
And one thing else, why do we have 7 trustees? A lot of boards have 5, some boards have 3. I just want to know if anybody has an answer to that.
Personally, I'll never agree to 3. I think 5 is a great number. 7 is harder. You know, it depends on what you're trying to represent. 3, we may have an official answer over here.
Yes. So it was a 5-member board. And then I have to look up the year, but it was it 2018? The board decided to add 2 more members. And so it was originally a 5-member board.
Okay. I just wondered.
I've seen
I'm not-
3-member boards
I'm not advocating
dealing
for
with a
change,
lot
I
of.
just-
Well, the county
It would be
commissioners used
nicer
to be
to have-
3, and now it's 5.
Well, there are still some counties with 3. What you find in a 3-member board, if you have a very strong individual and maybe more of a follower as another member, that maybe the community isn't represented as much. I'm not going to say that the real strong person isn't a good representative,
Right,
but it'll go more their way.
if you have someone that's taking advantage of that, it can lead to problems.
Yes, I would
There are
rather.
some situations where it wouldn't,
Yep.
but there are some situations where it
And there's many individuals that it would never happen, but it has happened in other boards with a 3-member board.
Okay,
Team, I just want to let you know the statute requires 5 or 7.
Okay, thank you. Got that one taken care of. Okay, Karine, are you good?
I'm good.
Karine, what are you thinking?
Okay, you guys have addressed quite a few of the ones that I had already thought. But there definitely is a lot of confusion for me about not only when you're elected, when you're actually officially in office. And I also think there needs some clarification on, like, where in this previous situation where the officers were all not voted back or, weren't returning as candidates. I think we need some mechanism to have someone leading the board at all times. And so whether that's, I don't know exactly, I haven't formulated exactly how we do that necessarily, but I think we need to definitely clear both of those things up so that it's very clear who the board is at all times, like we've said, and who the officers are.
Or at least
And if you're, or who at least the acting chair will be, if all the officers are no longer a part of the board the day after the election or whatever. So I had that. I actually don't mind the liaison concept if we define pretty clearly what duties we think the liaison concept encompasses. So, I mean, I kind of feel like, I mean, there has to be communication, clearly someone that can communicate back and forth, but I do think that it appears to me that in the past there was potentially decisions beyond just communication that were potentially made by solely the chair, and so I think we need to address something about that. I'm trying to look. We have 3 minutes here, and Ann still has to talk.
Just take your time, Tony.
That I think. Oh, there's also because these drive me crazy. There's a spelling error. I think in section 4. 1, 2, 3, the fourth line where it starts approved bylaws, rules, and regulations for the medial staff, I think is medical staff. So we should clean that up while we're fixing these, because I don't know that we have medial staff as opposed to lateral staff. But anyway, I think otherwise you guys have probably addressed the other. I do think that Mary's idea for some sort of orientation for a new board member is a very good one as well.
Go ahead, well, you've only got 30 seconds to give your idea.
I have a lot more work I have a lot more to say than 30 seconds. Oh dear.
It was just an idea, it wasn't an accepted idea.
Yeah, we didn't vote on it. I did say 9's too late.
I know you did.
Oh dear.
But you were talking about 9 a.m.
Oh, no, I wasn't talking about 9 a.m.
What was that you said before you spoke?
Okay, so I agree with Carrie that we need a cut off. We need to clean that up so it's clear. I agree with Corrine. So what I wrote down is after I talked to Nathan earlier yesterday, I think I wrote down what the chair should be able to do and what they should not be able to do, and from that came the whole deal with the not being able to remove somebody from the committee without a whole board vote. And so, under I feel like there's some things that I have not necessarily done a good job of. It was very hard to be under chairs that didn't allow us to talk to the CEO. And so in a lot of ways it feels like I've went the other direction, which might have made it hard. Like, I don't know. I do not know what board members are asking Kathy to do. I just don't know. People are asking her what to do, and to do things, and I just flat don't know about it. And that's too far the other way. That makes too much work for Kathy, me not knowing. And the other thing that I don't feel like, and this isn't dealt with in here, at least not in this section at all, maybe it is later, but the other thing that we should think about, I think it makes perfect sense that the chair is the liaison with the lawyer, because we don't want 7 people racking up bills. But something that we need to think about is the press. And that probably really should be my job, but I haven't wanted it. And so but in reality, it would be good in some ways if the chair was, I mean, you obviously can't keep board members from talking to, I mean, we all have our free speech right, but there should be one person designated that's kind of takes the lead on it, I think. And the same with taking the lead on talking with administration. I mean, but it was, and so I don't know how to make that, how to balance that. But it is important that there's a primary lead on all those, on talking with administration, on talking with the press or the / community, and talking with the lawyer. But I do not think it's good to say, well, nobody on the board can do any of those things except for the chair. That's not good. And so I don't know, I just don't know where the balance is.
But I just kind of had a little light go on there. Honestly, when you think about it, the way that's worded, primary liaison, the word primary, I mean, leaves the leeway that everybody's kind of talking about here. It's kind of determined by the chairperson. But that chairperson, honestly, by what that reads, when they said you can't talk to, well, primary liaison, that isn't what that says. I can talk to whoever I want.
It's not a may or shall.
Yeah, and I mean that, so it gives the leeway.
We all have our free speech right.
Right, so, I mean, the way that should probably be run, I agree. You know, somebody's gonna talk to the press, they go to you, you say, no, I'm gonna do it, or, yeah, please, I designate you to do it. So liaison, I guess maybe is the right word, because and then what that word previous to it, primary does not mean I can't. But you're the chair's position would be to say, please inform me. Now, I'm the primary liaison, I should know, but that doesn't restrict. So honestly, I don't see how a chair could kick somebody off the board or remove somebody from position by violating that from that wording, primary liaison.
Well, right, so Ben,
Well,
that comes from the sentence above.
That comes from the chair has the appointment.
Well, right.
Well, but if we fix that,
that, then we don't have to
but
change
I don't know if we need to
liaison,
change that
maybe.
primary liaison. Just from what you're saying, that kind of light came on. I mean, that really is not, thou shalt not talk to anybody but, I mean, it doesn't say that, right?
Yeah, it's a may.
Right.
It's not a shall, it's a may.
So that makes a little more sense, but I agree.
Shall not.
All of
or
those
shall.
things as the chair would be to say to us, hey, I don't care if you talk to the press, but let me know about it. And I might choose to be the one to talk instead. Let me know about talking to Kathy. That is well within this idea of primary liaison, right? Am I missing something there?
No, I think that's.
I kinda see that now.
Primary is,
You can see why it's there.
Can I throw out a real quick idea, something to think about? You know, of course, these terms are supposed to be staggered, but don't know who's going to be elected, who's going to be chairman, who's going to be secretary,
And it's
treasurer,
staggered
whatever.
as much as it can be.
Yeah, it's
2
staggered.
years.
But maybe a solution to that is if we're facing an election, that the board, maybe at election time or later on, choose to vote for a vice president, 1 and 2. And 2 would be the one that is not up for election, or not the normal vice president.
Or
That way
just-
they would be in charge of the meeting if no one was elected.
But-
I'm creating a problem, but I see that. We're trying to solve a problem.
Right, but then it's also the past board dictating the actions of the future board.
For 2 weeks. Or
For
for
however long.
Till elections are held.
Okay.
Yeah, so.
Or if we switch it so that the board, it's very clear the board is on this day, and we move the meeting where they elect officers up, so there's
Sure.
less of a gap. I mean, that's hard as a board member, though, having your very first meeting, electing your officers.
And I agree with that,
But it's gotta be done.
I
But it has to be
understand the
done.
gap there, but also at the same time, the election officers should happen very quickly, but if you're a brand new board member, I may not know you.
Yeah.
We're not campaigning to be chairman or secretary or You know,
I
some
think-
people you get appointed to certain positions, you know.
Sure, go ahead, Corinne. Sorry.
What if a board prior to an election elects an acting chair and that person for the term of 1 month has to be someone who is not up for election, and you have an acting chair of the people who were not up for election, and that one takes over and runs until you hold the election?
I like your idea better than my statement. I think that,
Yeah, she's saying what you meant.
well, I think she is, but she's saying it better.
Well, thanks.
So I agree with that statement. So it's something to consider, you know, because you've seen this problem before. It's not like it can't happen.
Okay, so where do we go from here?
What else do you have, Madam Chair?
I think that was, so I've written down committees like we talked about, chair. So this is just talking, it's not, this is just writing to myself so that I know. So I said the chair needs to take the rest of the board's opinions and desires into account. And, which that can't go in the bylaw. I don't see how that goes in the bylaws, but it's still, I was just thinking about what the chair needs to be doing. The chair should be communicating with board, press, and CEO. Notice I said should, because I'm not. And then I also wrote, I have no, like, I don't feel I have any control right now over who talks to Kathy or what about. And I don't know that I need control, but I don't.
Well, I would hope Kathy would communicate back to you.
Yeah, well, I think it would, I mean, sure, yes, she should, but the board should communicate to me.
Oh, I agree. I understand. But if 3 of us or 5 of us are communicating with Kathy saying, well, we'd like this done, that done, hopefully Kathy would communicate back to you.
Right.
Oh, I agree. I understand. But if 3 of us or 5 of us are communicating with Kathy saying, well, we'd like this done, that done, hopefully Kathy would communicate back to you.
Right, yeah, that's true.
You know,
Yeah.
part of the situation isn't just you talking to Kathy.
It's
Kathy needs somebody to talk to
Right.
talk
So
to the
it's
board
maybe-
members.
yes,
It
maybe
works both
that's-
ways.
Right, but maybe that should be written somewhere as an expectation of a board member, not necessarily a duty of the chair.
Sure.
And we could possibly address that
An expectation of the board member would be a good.
The other thing that I think that we all need to take into account is just like this switch was a really big one. Like I came in as a new chair without anybody. I didn't even have the old chair to give me any advice. I didn't have a CEO to give me advice. You know, and I'm not saying that as bad. Like, I'm not making excuses. I'm just saying, and I don't know that that's how it will be. Hopefully that's not how it is for.
Well, maybe that's
for
where
future
you're working on your
boards.
orientation would be.
Right.
If you're in a certain type of chair, we have orientation for you if you're the chair, or you're the treasurer, or your secretary.
Which we try, we were working on that at the last board, and it felt like we were pushing down on the new board and saying, this is how your chair needs to behave, and that was nasty too, so there's just all these mediums we gotta figure out.
Well, yeah, but structure's okay, and giving structure to the next board's okay because they kind of need it at the beginning. They can change it later.
Yeah, that's true.
We just need to make sure in the bylaws, and there is, and maybe we need to spell that clearly, that whoever the board is, whether it's next board or 15 years down the road, they have the authority by the majority of them voting to change the bylaws.
Yes, we need to leave that in there, yeah.
Give them that opportunity. You don't have to spell out what they do. Give them that authority to change the bylaws to fit their board.
So where, like you said again, where do we go from here?
My suggestion is we take another couple pages.
And keep working at it like this, or would you rather do it all in a bigger chunk?
I don't know if we can do.
I don't know that you can take it in a big chunk. I don't know how my
Unless we
problem
take it 12
is,
hours to do
let's
it.
say I've got a bad idea, you wanna vote against it.
Mm-hmm.
We come to the end, Kareen's had her hand up. But we vote against,
Talk when you're done.
I've got a bad idea, nobody likes it, but it's tied to the document. Do we vote down the entire document because you don't like one bad idea, or you vote it by article, something or other, when it comes to the end?
Well, I think we just have to keep fixing it till we got it where we want it.
Well, to the majority can,
Yeah.
So you haven't agreed?
Go ahead, Kareem.
I think that honestly, to really do this justice, I feel like it would be nice to split this off from board meetings. This is going to, if we're really gonna do this justice and go through this whole thing, I almost think that we need to have bylaws meetings separately, like you said, 3 or 4 hours of a chunk. We still don't have to do the whole thing in one reading, but if we aren't also trying to do all the business of the hospital at the same time, I feel like I could definitely give it the attention it deserves.
I think that the bylaws are very important, but I agree, I think we need to do it outside of the business meeting. I think it would be better for everybody. I think we'd be able to, because, we talked about everything under the sun tonight, and now we're gonna go into the bylaws, and I think people just kind of get fried after a while, and I think maybe just.
And the sun hasn't set yet. We still have a couple more things to go.
I think, and I'm not in favor of an all-day thing either. I think it's.
Maybe too much.
Well, I think it's better to have maybe 3 or 4 hours. I don't know.
That's so.
But that's just my idea.
So if we did that, do we just plan a time when, so I think Kathy in her email, we haven't talked about it today, but talked about having trainings in April and May. And so then do we wait until June and spend some extra time on bylaw? So, take a day, or not a day, 3 or 4 hours, 2 or 3 hours, and work on it where we're fresh. What's the thought on that?
That's a good idea.
I don't care any idea as long as it's not the whole thing in one day or 12 hours.
Yeah, no.
I think it'd be overwhelming, but at the same time, I think what you're asking is herding cats. I think you need to make an executive decision and say, we're gonna work on bylaws on this day.
Okay, we can do that. If that's okay with the rest of the board, we can do that. And then if you want, and everybody doesn't have to be there.
No, because we're not gonna agree on the bylaws until we're ready to,
Right, but if we, you could, if you can't come, then you could give your ideas to somebody who is gonna be there.
So it would be more like a work session.
Yeah.
But if they're, but I don't wanna limit it to 4.
I think everybody's input was valuable today.
Oh,
And
absolutely.
if one of you wasn't here, I think we would have missed something. So to say that it's not important that everyone be there, I think it is, because everyone brought something to the discussion that I didn't think of, and everyone's opinion mattered today, I think, to me.
I agree with that, but I just didn't wanna everybody feel time-wise the pressure. Go ahead, Kareem.
I think we have to probably do these as a special meeting, don't we? Because if we're gonna have a quorum or more of us there, we just have to, so I think we should just start to set some special meetings And hopefully we can all find a day that we can do 3 or 4 hour chunks.
I think we shoot for after the training.
Okay, so start in June plan. What, you haven't said anything, Nate?
Sounds very reasonable to me.
Yes.
Okay, so, do we want a motion on that, or do we want to just say that's how we're gonna do it?
I don't think you have to have a motion.
I don't think we have to have a motion, but I can tell you.
The
Maybe
the
when we
board
get,
chair can schedule a special meeting at any time.
yeah.
Okay, that's what we'll do.
And I would like to give the chair permission from my part to let us know what sections she wants to discuss during that special meeting, so that we're prepared that I only want section 3 and you're going to talk about section 4, whatever.
So that's
you set the
another
parameters.
question. What do we wanna do with what we've done today?
Just move it on, hold it, and we'll talk more about it in June.
Okay.
Or if we need to, I don't know.
Okay, so,
Yeah.
and I will try to make a, I don't know, maybe-
Did you
maybe
all
Mary
want
and
to
I will talk
have Allison work on some language that we talked about? I mean, we were pretty clear on what we wanted to accomplish today. Do you want Allison to work on some language towards that?
I
Or
would
do you
be-
want to just wait?
I'm thinking no,
Okay.
because there may be something later on that will change our language. I think I wrote down, got some of your ideas and Nathan's ideas and your ideas. I think we've got something to work on, and then as we go through, maybe some of these ideas will become clearer, what we would like the language to be, or to include,
Or maybe we fix it in another spot.
or fix it in another spot.
Good point. Good point.
So Allison, how is your notes from this? You say-
I made some notes. I think they're enough for me to write from. The hard part about doing this is, until I understand that the board as a whole, a majority supports the position, me
That's a
writing
waste
it,
of-
I
It's
can
waste of
write
time.
it, but
Yeah.
I
that's
don't wanna
just-
waste your time
Yeah,
and money.
That's very true.
That I-
yeah, okay, thank you, Allison. Okay, so, back to the agenda. which
So I have a quick question. Are you gonna pick a June date, or you're gonna let us know in a month? or-
I will start talking to you about June dates at some point, hopefully trying to avoid open meeting law messes.
Discuss it to us in
Will you
July.
please make sure you check with my calendar too? just
Oh,
'cause
right, yes, thank
I'd
you,
like to
Allison.
be
Yes,
here.
yeah,
Thank you.
okay,
I
thank
have a
you.
baby in June.
Her son, hi.
Oh, I thought you
Well, that's a
I'm a
surprise.
little old for that. And his wife.
Congratulations.
So
That's what you're supposed to say, right?
Yeah.
So I have one more thing on this section. Kathy and I and Allison talked about putting times on the agenda that we did not stick to hard and fast, that we were aiming for. So just for information's sake, I wrote down times on some of the different places. At call to order, we're at 5:35. 6:35, we're on number 2 on CEO report, because I forgot to write the time down for right next to the CEO report. We started in on quality at 7:55. And I didn't write down when it was, what time was it? It was 8:20 when we started the bylaw discussion.
We have room for improvement.
That was a lady said at that thing that we shouldn't have more, what, than an hour?
90 minutes.
Yeah,
That's
but I
exactly-
think that's a terrible idea. I really do. If we get together once a month, we should give as much time as we need.
I
The
can
only
shorten up
other
my list, but
suggestion-
it's pretty hard.
Yeah, I don't like what Carrie, I know she and I have talked about some, she doesn't want to get to the point where, okay, so we have, 5:30 call to order, and then we're done with the agenda at 5:35, but we weren't supposed to start strategic initiatives until 5:45. Well, we don't want that.
Well, just, you can start on time, but then it's a rolling.
It can be,
schedule.
yeah, you can be earlier.
I
Just
just,
like
I
tournaments.
hate agendas with time on them because, and then like when Kim's talking, you're gonna say, all right, your time's done, we're on to Shane. Yeah,
Well,
it's
the other
not
problem
fair
is that-
either, so.
The other problem is we don't have the capability of having conversations away.
Right, this is the
So
only place
other boards
where
I've
we
been
can
on,
actually
it
talk
have-
about.
it's no legal requirement. You can,
Right.
you know, discuss things and then bring it and have 5 minutes rather than, but we don't have that luxury.
Yeah.
So we basically have to have the conversations here that we need to have.
I
so.
honestly do not feel like these, no matter how long they go, they're a waste of time. I just don't.
No, I don't think the board meetings are a waste of
I
time.
don't.
I think if
that.
we had appointments sitting there, a time is important to that appointment. You know, if we had somebody that we invited to come to our meeting, give a presentation, that time that we give them to talk to that presentation is important. I also would suggest that maybe we could change our agenda around. We have individuals here that are staff members
Mm.
that maybe they could go on earlier in the agenda, so
I
they could
agree.
go home
Yeah.
rather than
That's a good
8:39.
point.
I know we have
Yeah,
one staff member, maybe two with little children.
And then they could stay if they wanted to.
They're
but they wouldn't
more than
be
welcome to
required
stay.
That's a
Yeah.
good point.
Everyone's looking at me for, is it time? Can I go?
Yeah, that's a
Yeah.
good point.
yeah.
You know, that's,
So which would probably put the CEO report after.
I'm here anyway.
I know,
That's okay.
yeah. But, and then the other thing, you didn't talk about the consent agendas.
No, I didn't. I wanted to see whether you guys wanted to consider, especially because we're trying to improve on our reports, that we would work to have certain people like quality, HR even, and the manor put reports together that are in your packet a week ahead of time. And then those would be there for you to read, and then you could basically have read them and had responsibility to look at those. If you have any questions, you could ask questions, but it's consent, and you just consent to that agenda that, yeah, I saw this stuff and everything was
I love that.
Yeah, it would be a lot
Because
faster.
they provide us with a lot of information that I would love to be able to digest before because I know I miss half of it.
Yeah, so that's what we were thinking. If we could start to move that way, I talked to my team about it. It was like, how about if we move you into a consent agenda type of thing and have true consent agendas? And only if it's a special thing do they have to, you know.
I'd like to hear their reports,
Mhm.
but I think that could work with what you were talking about moving things around on the agenda. It would move them more towards the top. We could still visit with them,
Okay.
but approve their reports as part of it.
Consent agenda.
Consent agenda, but we would have it in writing beforehand,
Mhm.
and then we would
If
have
we
time.
read it, then we would be.
Yeah, I like that. I really like
well,
that
take
idea.
a little more preparation on our part to read it, maybe come up with our
Yeah.
questions and shoot digest. I'm one of these.
But I wouldn't want to structure it in a way where they don't come. They just provide
No,
a
I
written
think that
report and
it's
they
important.
don't come because I like that.
Yeah.
I wish every department would come because I think
Well, at some point, we
It's-
could do a
it's-
rotation of that too, and,
I like
and,
that
and
too.
have, departments come and present their department, you know, just to kind of talk about it. Those are things that I have ideas for, just been too busy financing this place, I think, so, anyway.
I've seen some boards get lazy with consent agendas and
Mhm.
things
Slip
that the
it.
board should be making a decision on is slipped through for the chairman's
Agreed.
signature. And, you know, okay, we didn't discuss buying a new copier for the business office.
Oh, no,
I'm
we
throwing
won't do
something
that.
out.
So what if we don't call it? I mean, we end up taking everything off the consent agenda anyways. We have one thing on it and we just take it off. So
That's
what
my
if we
intention to
don't-
take it off so we
Yeah.
don't have a consent agenda.
So what if we don't have, we
Yeah.
don't call it consent agenda, we call it department reports
Okay.
or whatever you wanna
Yeah, but I can
call it,
promise you,
and
they're
it
not
would
gonna have
just
something that they want bought in that report for you to
Well,
sign.
you know, but I've seen,
Yeah.
not saying
Yeah,
this
no, he's
organization.
right.
But you've seen it happen.
You're right.
I've seen it
the
happen.
county commissioners
Yeah.
too sometimes. Well, the county commissioners, they have a bunch of stuff on their consent agenda, but it doesn't come out to the people. So
No, there's
we
no
don't know, right,
transparency
we
in that
don't really-
consent agenda
No,
because
we
it's
don't
not
know what
listed.
they're approving.
Yeah.
For
'cause
one
it's
thing,
just
on the
a heading
consent
and we don't
agenda,
really know
they're not
what it
listing
is.
what they're consenting to. The chairman's signature to
Yeah, that's not it.
purchase a new sheriff's vehicle.
Right.
Okay, you didn't even discuss it getting, yeah, I'm not saying that happened.
No, you're right.
But there are
Yeah.
things that do happen in the consent agenda that I don't, so I don't
So
like
if you
consent
can name
agendas.
it, that
I'll
kind
figure
of
it out.
concept, name it something, but name it in a way that they still know that we want to see them here. I think that would be great.
Okay, sounds good.
So,
If the board has already given the chairperson an agreement to sign something, that can be part of it. In the previous meeting, that can be part of the consent agenda. We have the, now have the agreement with home services, whatever
yeah,
agreement.
we don't have that here though.
Yeah.
Be sure to sign it.
Sure.
But
But
yeah, I agree with you. I don't like that.
I don't like a
actual
consent.
I don't like approving things in a bunch.
No. Especially when the public don't know what you're approving. You-
I agree.
It's the last page.
But we
so
could
then I
bunch.
can fix everything else.
We can. I have no problem. I just,
One is better grade than paper next time.
Madam
So we
Chair,
just did it all, so now they have to listen to it too. Okay, so, go ahead, Ted.
I would like to make a motion to privilege.
Yeah, yes, I agree, I need to go.
I didn't say that, Ann. I did too. I do not like going into executive session and then us mingling with the public in the
Yes.
hallway.
So is there
And then us
anything?
what?
Mingling with the public in the hallway. And then,
Exactly.
what we need to do is we use the bathroom, what I'm going to plan on using, and then go into executive session.
So,
I've-
so how does that work with,
I think you need to make a motion to go into an executive session
but we'll do
and
that
take
after
a
we-
5-minute silent break.
No.
Oh, no, cause
Where
I'm gonna
you
talk.
where you punch somebody in the mouth if they come and try to talk.
No.
No.
You do need to
We've
make
had
a motion to
situations
go into
here that
executive
we've had a
session.
number of people in the hallway
Yeah.
wanting our attention while we're trying to weed our way to the bathroom.
And I would just say to them, I'm not gonna talk right
I'm
now.
not going to be rude to someone that I,
That's not being rude,
So
that's
let's-
being
everybody,
straightforward.
let's
The only-
take a
the only
5-minute
thing
break.
this is
We'll go
helping
back to the
is
executive
you
session in the,
not hearing us going into executive session.
at 9:35. So we will
And
go
I'm
into
gonna
executive
say,
session at 9:35.
you don't run our
Can we
meetings,
have a
I
we
know.
run our meetings.
That's
So-
what they would say. And that's being straightforward,
can
not
just
being
say,
rude.
Announce that
We'll
she's
make
doing
that
a break.
announcement at 9:35.
So I'd like to take
and
a
we'll do it.
break and then go
Okay.
into executive.
So everybody got that?
Michael Stulkin did things right. And what Nathan Todd did in that meeting, dressing him down, he said not to pick sides. No, he did pick sides. And he picked Becky Hadlock's side. And once again, Becky Hadlock was wrong. So thank you on behalf of the people of Weston County to Michael Stulkin for stepping up and doing the job that the people elect him to do.
Well, and not only was she wrong, but once we finally got our records request, she was even more wrong because it was incomplete. And the state public records ombudsman admitted that and said that those documents should have been included. So I just find it interesting that everybody puts faith in someone who continues to make the same mistakes, which at this point aren't mistakes.
Right. You're running.
Okay, just once. You don't want to record still?
Okay, so, I would entertain a motion to go into executive session. We have everybody
Madam
ready.
Chair, I move.
The door needs to be open till you go.
One of them is.
Yeah. So, did Ted so move?
Yes, I did.
Do I have a second?
I have to read this thing.
Okay.
Yeah, I need to read that
Ted
statement.
needs to read it. Give it to Ted.
Under Wyoming statute 164405A2, II, to consider the appointment, employment, right of to practice or dismissal of a public officer, professional person or employee. 9, to consider or receive any information classified as confidential by law, parentheses, including attorney-client privilege, communications, quality information, and trade secrets. And 10, to consider accepting or tendering offers concerning wages, salaries, benefits, and terms of employment during all negotiations.
Been moved and seconded. All those in favor say aye.
Aye.
All those opposed, same. Okay.